All right. Good morning, good afternoon, everyone. Thank you for joining us today. We are very excited to have you all here as we do our African Futures Research Showcase. So this is an opportunity for our African Futures scholars to demonstrate the work that they've been doing over the past year. As many folks know, the scholars have been at MSU since last year, working with faculty mentors at their home institution and at MSU to build their research skills and become research leaders in their various fields. So we are very excited to see the work that they have been doing over the past year. But before we get started, I wanted to briefly go over the agenda to lay out the plan for today, and I will then turn it over to Richard McConduary for opening remarks. So our agenda this morning, we have a lot to get through. We have grouped our presentations into three groups by topic. So we have culture, society, and health up first. Then we have science, technology, and innovation. Finally, we have agri-food systems, youth empowerment, and education. After each group, we will have an opportunity for Q&A. So we ask that you use the Q&A feature in Zoom to ask any questions during the presentations, and then we will get to those at the designated time for each group. Before we move on, I did want to mention that this is going to be recorded. We will share the link with all attendees, and we will also post on our website for those who were unable to attend. And without further ado, I would like to welcome Dr. Richard McConduary, who's the AAP Africa Office Director, to give us some brief opening remarks.
Thank you very much, Justin. Good afternoon, colleagues from Africa, as well as colleagues from the US. Would like to welcome you to this webinar where African women scholars will give their presentation. They'll showcase some of their work. We from AAP consider the African Futures Program as a flagship program for the Alliance for African Partnerships. Mentees who have participated in this program have over the years excelled in their respective careers. They've established sustainable partnerships with their own mentors and also with others. They've been linked to wider networks in their own respective professions. They've been able to jointly publish with their peers and also with their mentors. They've been able to enhance the visibility of their work across the continent. So we're very excited, that this program is up and running. And naturally, as they make their presentations, we hope those of you who have joined us will actually be open to linking up with them to expand their knowledge, to expand their scholarship. We see these young scholars as champions of AAP, but more importantly, as champions that are committed to seeking innovative solutions to the challenges that confront Africa, more particularly within the context of the Africa we want and and under the Africa Agenda 2063. So we're truly honored that you're able to join us, and we look forward to fruitful discussions and fruitful presentations. And also, we look forward to any questions that you may have based on the presentations they'll be making. So thank you very much. We look forward to some fruitful deliberations. Thank you.
Thank you very much, Richard. All right. So without further ado, we will dive right into our presentations. First up, well, actually, sorry, before we dive into our first presentation, I just wanted to briefly introduce our scholars for those who may not know all of them. They will introduce themselves within their presentations, but just wanted to show sort of the breadth of scholarship that we have here the institutions represented from across the AAP consortium in a variety of different disciplines, and you will learn more about each scholar today. So first up is Dr. Lesedi Mashumba. So Lesedi, do you want to take it away?
Yes, thank you very much, Justin. I will just quickly share my screen so that I can share my presentation. All right. Good morning, everyone, and welcome to our showcase that I hope we are going to all enjoy since we'll be sharing what we've been doing so far. So my name, as I said, is Lesedi Mashumba. I'm a criminologist by profession, and my research looked at modernization, indigeneity, and territoriality, exploring the land dispossession and criminalization of the Basara people's livelihoods. And this study was sponsored by the African Futures Program, and we are grateful for the support. So in terms of my presentation outline, I'll delve into the introduction, the background, the methodology, and within findings, I'll only present about 3 findings since we will be constrained by time. Then delve into the discussion as well as a brief conclusion. So in terms of the introduction, as my study looks at the Basara peoples, these are known as in colonial texts as the San or the Bushmen. And they are regarded as one of the oldest hunter-gatherer groups to have inhabited Southern Africa. Even before the influx of the Bantu people from Western Africa, whom occupy Botswana and parts of Southern Africa today. But we've seen the past 50 years being, a locus of protracted and at times desperate and dramatic struggles over land resources, identity, indigeneity, and citizenship, mainly because the government of Botswana turned the area that they used to live in into the Central Kalahari Game Reserve. So because of that, we see a history characterized by oppression, discrimination, and thus this thesis engaged in an ethnographic study among the Basara people in their new settlements, the settlements of Kere, New Gade, and Gaudwani, so that we may explore their experiences, perceptions, and attitudes about the development that was promised, the criminalization of their livelihoods, as well as the resettlement and the land disposition itself. And just to give a brief background overview, there were about 3 forceful evictions from the CKGR. These clearances occurred in 1997, the first one. In 2002, another clearance followed. And in 2005, that was the last clearance that we saw from the government of Botswana. And the government of Botswana justified its actions, citing that the relocations served a multitude of interests, such as making sure that they were developing the Basara people and also preservation of wildlife and the ecosystem of the CKGR. And that's because then the enactment of the 1992 Wildlife Conservation and National Parks Act had also created several offenses to protect wildlife, habitats, and plants, which criminalized the Basara's ways of being. Hence, they could not continue living in the game reserve. In fact, we see this since even the 1966, where the government is trying to sedentarize the Basara people and transform them into modern citizens who keep livestock, who engage in proper agriculture of planting crops, and who also engage in business, which is what they call a Tswananization strategy, which means they were not really seen as the part of the Botswana people, but a different community altogether, whose hunting and gathering ways were being seen as backwards and primitive. So in terms of methods, I used I used qualitative research methodology, which allows you to interact with the people. And because it was a phenomenological study, I had to engage in community-based participatory approaches that take into account the culture of Botswana as is, and which also in a way contribute to the decolonization of methods, because we take culture, the people's ways of being, at the forefront. And in terms of data collection, I used face-to-face interviews using semi-structured interview questions, which were then conducted with 36 participants in the new resettlement areas of Kaudwani, Nyikade, and Kere. And this was done in a space of 3 months. And I then used abductive thematic analysis to analyze the data. And abductive thematic analysis allows us as researchers to come in with preconceived ideas before even analyzing the data, because we have to acknowledge that you'd have done even observations of the communities before you even interview the people. And hence you already have preconceived ideas of what could be happening looking at the surroundings. And of course, research ethics involved informed consent, transparency, verbal and explicit consent, procedures used to confirm anonymity and confidentiality. And in terms of findings, we found that the relocations did not take place in such a way that was desirable most times. Threats were used, coercion was used, the cutting of resources such as not fixing boreholes, no food baskets to the Basara people, no medicines, even not giving them hunting licenses so that they don't become comfortable in the game reserve. There was also a theme to loss of livelihood and a lack of legal protections and customary communal rights to resources in the CKGR. And you find that then the government promised to give them cattle and food baskets, as well as medicines and jobs if they relocated to the new areas. And traps were also being set up in the game reserve to prevent hunting. And also there was a shoot to kill policy that was introduced. And this shoot to kill policy would actually be justified if one of the Basara people, who would now be regarded as poachers, was to be killed while they were hunting without permits. And at theme 3, we see the lack of access to education, which of course very much impact on the life chances of the children, and hence the vicious circle of poverty continues. Because if there are language barriers where teachers do not speak the language of the students, they are not even trained in indigenous languages, they're not going to be able to reach out to the students. Bullying occurs, the education policy is not inclusive, and also corporal punishment was still being used, such that students even feared corporal punishment. The lack of resources in boarding schools also hindered proceeding to secondary school. And then alcoholism was also a problem in the society, such that, the mother, the father is at a depot when the child comes back from school, and the child goes to the mother and the father at the depot. And what do? They give him part of what they're drinking. Now the child is also drunk at the depot, and they forget that they have school tomorrow. So that vicious circle also continues. So just to quickly go through the discussion, we see then that indigenous people, the Basara peoples of Botswana, they occupy multiple complex and relational positions across diverse economic, social, and political and institutional, as well as meaningful and epistemic spheres, which I have expressed in material, embodied, grounded, and interpreted in intersubjective ways. And this doesn't just happen with the Basara people of Botswana, but mostly even San people across Southern Africa, even indigenous people, the Hadebe of Tanzania, all the other people from other African countries, you may find they face the same challenges that the Basara people face. And in order to understand their experiences, their attitudes, I used the theoretical frameworks of Nkukiwa Tuyogo, who has coined the concept of dismemberment, Michel Foucault's framework of governmentality, and Mark Jesler's concept of enclosure, to try and understand their experiences and craft a critique of the evictions themselves. And we found, that those enclosures that they were put through, they did not necessarily follow the innocent necessary tale of land-based people saving money to voluntary exit, or the government coming innocently and asking people to voluntary exit, but they were actually characterized by violent dispossession and displacement of these people, because the Basara people were being forcefully removed. And so in another way, they also cleared a way for the Gago mine to actually open, as well as for the tourism sector to continue booming. In conclusion, the evictions from their ancestral lands and forced movements in areas that are remote and often disconnected from modern cities have driven and been oriented by poetics of otherness. Otherness is where we say we are the Batswana people, they are the Basara people. And if we continue to otherize them, we continue to lead to their marginality. We continue to see them as people not belonging and not deserving of unless it's for us who curate their belonging as the superior self. So redressing these issues is going to need a broad-based, inclusive, and complex, as well as a multi-scalar solutions that need to take into account and reframe indigeneity, territoriality, and belonging, so that the Basara people may see themselves as citizens that belong to the country, that contribute meaningfully to the economy of the country. And I also argue that Botswana also needs a national education policy that decolonize knowledge systems, that acknowledge histories, that have respect for and inclusion of the indigenous people, their cultural values and ways of being, so that they may also enjoy their full citizenry. So I will stop here and thank you so much.
Thank you so much, Lesedi. That was great. All right. Reminder to attendees, please put any questions you have for Lesedi or for any of the other presenters in the Q&A, and we will get to those at the appropriate time. So next up, we have Dr. Quinn Orwa from United States International University, Africa, out of Kenya. So Quinn, if you are ready, we will hear from you.
Okay. Allow me to share my screen, Justin, please.
Yep, go ahead.
Thank you so much, Justin. My name is Quinn Orwa. I'm an assistant professor at United States International University, Africa, and I have the privilege of presenting these projects that have been undertaking for the past 1 year. The main topic is the Luo, an indigenous language that is spoken in Kenya, and its role in public health communication. So this is a very interesting topic that I've been so motivated in looking into, and it touches on 3 types of cancers, and that is prostate cancer, breast cancer, and cervical cancer. And these cancers fall into the category of non-communicable diseases, which is abbreviated as NCDs. And so non-communicable diseases are always those kind of diseases that have got long durations and slow progress in terms of mitigation. And approximately 9.0 million cancer deaths are reported annually. That is according to the global cancer statistics. And therefore, it is very imperative that every researcher on this land get to actually feel and find a way of trying to find mitigations towards this. And as an applied linguist, I find that there is a role that indigenous languages, especially the ones spoken in Kenya and everywhere else in Africa, has to play in early diagnosis, treatment, and management of this disease. And so cancer at 75.1% is one of the leading death globally. That is WHO 2020. And also it is the third top 4 killer disease after cardiovascular, respiratory, and diabetes. That tells you how critical this disease is and how fatal it is to the society. And so in Homa Bay County, the study location, it is ranked number 2 after maternal neonatal health, death, and also HIV and AIDS. Therefore, with this background, this project sought to investigate the role of one of the local indigenous languages that is spoken in Kenya, and that is the Luo, which is also the researcher's mother tongue or indigenous language. And notwithstanding that there are over 60 languages that are spoken in Kenya, and that makes Kenya a multilingual society. So the three types of cancers here, one is the prostate cancer, which is always male. The images are showing is the communication between male in a local chief's barasa, but they are animations. And of course, the bar graph indicates the global cancer statistics. That just shows the magnitude of the disease. But at the same time, there is the issue of the contribution that cancer makes at about 13% of the entire male cancer incidence and about 11.3% of all male cancer-associated mortalities in low-resource settings, of which Kenya is one of those developed countries falling under low-resource settings countries. In Homa Bay, the prevalence of prostate cancer as at the time of data collection, the screening was at 5%. But after the focal group discussion and interaction with the participant, they are willing at 81% to, of course, undergo the screening in the future. So that is how it is in Homa Bay County. With cervical cancer and breast cancer, it is also recorded that it's one of those, there are 2 of those diseases that have actually been affecting the society. But remember, some of the diseases that are also on the background are HIV and AIDS. And so the Kenya Cancer Report 2021 finds the breast and cervical cancer among the very common cancers among women nationally. And so as much as the government and the NGO's role has been to sensitize and have actually, sensitize people to knowledge utilization and cancer management in the country, they've done very well. But all this is done through the communication of English, which is the lingua franca, but also the language of instructions that is used broadly by the medical practitioners and the service providers in the country. And so that inhibits the reach out of leaves out a lot of people in the rural areas who are not perhaps health literate in that aspect. So the disease continues to claim so many lives, with the latest survey ranking it 3rd in the country, but also 2nd in Homa Bay County. So what were my objectives? I had 2 broad objectives. One was to investigate the effectiveness of the Luo language in doctor-patient communication on diagnosis, treatment, and management of those 3 types of cancers in Homa Bay County. And then also to examine the Luo sociocultural constructs that provide the foundation for effective communication on diagnosis, on treatment, on the management of this type of cancers within the county. The study locale was Homa Bay County, one of the 47 counties in Kenya, and it is also known as county number 043. I looked at the 3 sub-areas and all what we call the sub-counties, and that was Karachuonyo, Suba North, and then Homa Bay Town. The data collection methods were surveys. We did an online survey, and then I did focus group discussions, key informants interviews, and I applied the mixed method design. Of course, strangulation approach was also used for greater validity. And my target population was actually 30 plus, because cancer affects that category of people. And of course, I had to engage people who are community health volunteers, medical practitioners, doctors, both nationally and locally. Now, I picked quite a few of the key findings, the very many interesting findings, but for the interest of time, I identified a few I want us to look at. The color blue in the pie chart that is presented for you is indicating 95% of the patients in Homa Bay County who use the Luo as indigenous language. That means that the Luo is the catchment language that is used in that region. Only 5% would use Swahili. Swahili is a national language that is used in Kenya besides English, which is the language of instruction. And this shows that the choice of language in public health affects and interferes with the doctor-patient communication. There are other findings that I could not present here, but they indicate that the doctors and medical service providers were more comfortable using English at 68%, meaning that that is the language that they use during their training, but also not all doctors originate from Homa Bay County, considering that Homa Bay County is just one county among the 47. And so not all those doctors would then speak the Luo. But having said that, there is 77% doctors confirm that there is need for a medical language policy that would obligate them or hold them accountable in even getting the interest of learning the language of the catchment. Furthermore, there are no trained translators or interpreters that are specialized in medical field. And so when you look at the bar graph, the pie chart and the bar graphs that are presented, it just gives us a feel of the national figures at 94% and 95%, that both agree that there is need for people to reach a consensus through a common language that can then be able to disseminate information that are very critical to the rural people who speak the Luo. Because if all the literature is portrayed in English and given in English or in Swahili in some cases, trust you me, not everybody is aware, is having the health literacy enough to actually fathom the procedures and medical prescriptions that go with the magnitude of the disease that we are talking about. And so part of this, you'll also notice that the caregivers kind of felt the need of also getting the translation assistance at the healthcare facilities, because at the moment they have to struggle. A lot of times there's miscommunication between the caregiver, the patient, and the doctor. And it's because there is a whole channel of discourse between the caregiver trying to translate the symptoms of the disease to the doctor, and then the doctor has then to do the same to the caregiver before it gets to the patient. And that then prevents or hinders or prohibits the proper communication between the doctor and the patient. So 64% of the doctors prefer English, which is fine, but speaking Swahili most of the time, with 27% of these just being able to make efforts to learn how to communicate in the Luo. A second objective was looking at the key thing of the Luo socio-cultural constructs and how this happens and how this affects the diagnosis treatment of this disease. In many cultures, including the Luo community in Kenya, there are often taboo words. There are always social constructs or traditional beliefs that go into how we communicate in that part of Africa. So there are often taboo words associated with genitalia, and those words can vary significantly in their connotation and usage. And so in Luo community, for example, certain words referring to the male and female genitalia are considered taboo words, like they are no-go zone words. You're not supposed to speak them, or call your mother's breast, or talk about the cervical, and because these are diseases that touch the person. There are parts of the body that are organs that touch the person, and so they are avoided in polite conversations. So for male genitalia, the term they would call, it would be rainbow. Rainbow is sometimes used, but it's not a very common vocabulary in the Luo. But you find that the old men would use it, just the same way they would say prostate cancer is referred to old men's disease or tuojodongo, for example. So in in those cases, when rainbow is used, then it is considered a vulgar language. And in specific contexts for female genitalia, they use chira. And so in all those, we find those two words in the Luo very inappropriate or vulgar. In Homa Bay County, for instance, as it is in other Luo-speaking population, it is essential, therefore, from these findings to be sensitive to cultural norms and practices, because those words are typically used in formal and in private conversations, not in polite settings like in an hospital kind of a scenario. Another issue was euphemistic expressions where people use euphemism and to camouflage or to cover up for the real disease. And so that again takes so long for people to, or for the doctors to actually understand what it is that people are suffering from. We also have issues to do with religious beliefs. And these religious beliefs are faith-based healing. Reliance on prayer and faith healing in churches has also been discovered during our qualitative and focus group discussions, that it also replaced conventional medicine. When we think about the traditional healers in Luo community, they are people who people sought first to help with, cancer symptoms, believing in efficacy and herbal remedial and spiritual healing. And these supernatural causes actually delayed those symptoms or being taken, people being taken to the hospital, because people attributed the cancer symptoms to curses, witchcrafty, or displaced ancestors, leading to delays in seeking conventional medicine. There are also just a couple more: stigma and discrimination. Now, when we think about this actually, it's a big issue because, as I mentioned earlier, that besides cancer of the breast, cervical, and other cancers, there's also HIV and AIDS, which is predominantly affecting people in this region. So when we think about cancer as a stigma, there's the fear of being ostracized due to cancer diagnosis that can lead to individuals to conceal symptoms and avoid seeking medical help. But also there's HIV AIDS intersection. So in Homa Bay County, it has HIV high prevalence, and the stigma associated to HIV and AIDS can impact cancer care, and therefore leads to maybe what we would call the dual stigmatization. And therefore, when we think about all that and cultural perceptions in terms of fatalism, the fear of just being told that you have cancer, and the social economic factors that goes beyond the pocket, the ability to even have the money to support the treatment, then it becomes a continuous problem that needs to be addressed. But over and above, the main objective here was actually to look at how then can all these attitudes, perception that is contributing to these key dimensions that I've just talked about be done away with or be improved. It is through the use of indigenous language, because if literature on these three types of cancers and all the chronic diseases, NCD diseases, is communicated to a language that people can understand, the language of their mother tongue, then in other words, people will be able to be more convinced than ever in regards to when and how they need to seek treatment. Otherwise, it remains just a mystery, and the cancer seems to continue to just claim more lives. As I wind up, I want to look at the future directions and the way forward, because there is a lot that we could talk about this. But we have an ongoing program with NLP, or natural language processing, and we are building corporas with AI and digital platforms. So one of the thematic areas in the next projects, when we get the funding, would be actually to get the health thematic areas more reinforced. And two, we're looking for more research funds just to make sure that I do more comparative studies with other indigenous languages, considering that this was just one language out of the many that are spoken in Kenya. So conducting comparative analysis between the Luo and other indigenous Kenyan languages to understand the unique and common challenges faced in cancer care would be very important, as well as the longitudinal impacts studies just to see and track the impact of the use of indigenous language on cancer diagnosis, treatment, and adherence and survival rates over time. That is something that would be the way forward. But also just to assess the changes in patient knowledge, attitudes, and behavior if translation and interpretation is taken into place, but also just be able to share these findings in depth, not within the short time that we located, to the county government and the national government, just to see how advocacy and policy implementation can be taken root into. And finally, just to look at the community engagement and healthcare providing services and be able to use the knowledge that we have in a way that we can start translating the posters and the information that we have already in English or Swahili back to the Luo. Finally, and in conclusion, I want to quote WHO 2021, where they say, and I read, using indigenous language in public health communication is crucial for ensuring that health messages are understood, culturally relevant, and effective in reaching and empowering communities to take control of their health. And the other one, I'm sure you've read. I thank you. I thank my employer, USA Africa Alliance and Partnership, for the support, the funding, and all the staff and the administrators in that office, my able mentors ever present, Professor Diogo Nyani and Professor Martin Joroge, my research assistants, my cohort 4 sisters, I'll miss you. Thank you very much.
Thank you so much, Quinn. All right. Next up, we will move right along to Dr. Khadijatu Toure. Here we are. So Dr. Toure is from the University of Arts and Letters, Bamako in Mali, and I will turn it over to her. And quick reminder to all attendees, I see a lot of chat has been generated from our first two presentations, which is wonderful. Please be sure to put any questions you have for the presenters in the Q&A feature. So Khadijatu, I will turn it to you.
Okay, thank you, Justin. I'm just going to share the screen. Yes. Okay, next slide. So thank you. Good morning, good evening, good afternoon, everyone. I'm Khadijatu Toure from the University of Letters and Human Sciences in Bamako, Mali. So I have been working on the national languages issues and bilingual education in Mali, which refers toward a digitization of code switching. So as a background information, Mali is a multicultural, multi-ethnic, and multilinguistic country with more than 50 languages spoken there. And among those 15 languages, we have 13 which have been recognized as national languages. So recently, with the new constitution in July 2023, the 13 national languages have been given the status of official languages. And the former official language, French, is now the language of work. So with this research, we have been concerned with two main aspects. The first one deals with the analysis of the language policy with the objective of identifying and looking at the challenges and perspectives that stem to the new situation. And second, we have been concerned with the bilingual education, which in Mali refers to the use of the people's mother tongue with a transitional shift to French at the first level of primary school. So in terms of methodology, we have been dealing with secondary research when it's come to the language policy. We have been looking at the different documents relevant to the language policy in Mali, and also submitting Google form surveys to specialists in linguistics or languages in general, or language planning and other participants. And when it comes to the bilingual education, we have been using the software Clan to analyze recorded videos of classroom practices after transcription. So in terms of, as far as the language policy is concerned, of course, officializing 13 languages represent challenges and perspectives. And for the perspective, after looking at our different data, we have seen that it's mainly in the domain of media, of education, and administration. And again, the challenges are at the level of instrumentation, because those languages are not sufficiently codified to be used in every domain. So there is a need of instrumentation, and also working on the development of educational support, educational documents, and teacher training, and the financial resources, which is an important one. And so that to mitigate some of those challenges, we have suggested the convivial multilingualism, the functional convivial multilingualism, and decentralization. And this simply means that those languages have different demographic weight. A language may be used in the southern part of Mali, and it is not as part of the major languages in the northern part. So based on this difference in terms of demographic weight, we can give the languages, assign them functions in particular geographical location or administrative level. And this is what is meant by the functional convivial multilingualism. And decentralization as well, because this requires really the use of a specific language depending on the collectivity where we are. So these two approaches can be used to mitigate these financial aspects of the challenges, because it is not all the languages which will be used everywhere and at every time. So, and again, it may just be like the already natural attitude we have, because it will be just leaving the languages impose themselves by their dynamism, because that is what will give this different demographic weight we already have. And in that case, it may give birth to what is called in language planning glottophagy, where we will see the major languages or the majority languages just eating the minority ones. And at the end, those minority languages are going to be endangered language or disappearing through time. So again, the language policy is just respecting this multilinguistic environment, the multilinguistic aspect of the country, but at the same time, when it's come to language promotion, I think they need to be promoted at different levels, so that to give change to all those languages to be raised, to be promoted at different levels. And again, it is through education that we can work on all those aspects. We can work on copy, status, or acquisition planning, and really ensuring a real language promotion. So that's what directed us now to look at the bilingual education in Mali, which is, as I have said, the use of the mother tongue, the people's mother tongue, with a transitional shift to French at the primary school level of education. So then we already have some experimental schools. We have been video recording those experimental schools with a focus on code switching. So the objective was really to look at what are the type of code switching used in the classroom context, what are the functions they fulfill, and also be able to work toward a model of digitization of code switching as a real tool for bilingual education. So in this perspective, after analyzing those recorded video, thanks to the software clan, we have seen that teachers make use of more intersentential code switching. First, we have the three types of code switching which are used: the intersentential, the intrasentential, and the extrasentential code switching. So they make use of more intrasentential code switching than inter, and that was not really expected at the beginning of the work, because the intersentential code switching is the one which occur within the same clause. And then teachers normally are supposed to shift when maybe they are dealing with explanation, or they are saying a term in French and then they need to reformulate it into one of the national languages, so that to make the content accessible for the pupils. But instead, they were dealing with intrasentential code switching and not intersentential code switching. So they may have reasons behind. I'm not going to go very into detail because of time constraint. But when it's come to pupils, it was the opposite situation which occurs. And that was also surprising, because they were using more intersentential than intra. as beginners with those two languages, they were supposed to mix up the two languages and making use of more intra-sentential code switching. But on the other side, they were using inter, it's mean using one language, a sentence in one language and a sentence in another. So, and that was not really expected. So it's mean we need to look then at the functions of those code switching, the use of code switching. And when it comes to functions, they are used for, we have been relying on the pedagogical interaction functions. So they are used for request, for explanation, to emphasize on a particular content or a particular aspects. So then we divided those functions into didactic functions and non-didactic functions. So the didactic functions are those who are going to contribute to the learning, those who favored or are going to help to the acquisition of the two languages, because that is the purpose. And the non-didactic function is when it is simply used. Sometimes we have find that teachers were using it because of familiarity. It's not they try to convey, to explain, to make a research or to emphasize on a particular content. It's simply because they were used to the use of a particular term in a particular language that they make the use because of familiarity. It just comes naturally. Or when it deals with the meta terms. The meta terms are words used to explain language. And sometimes we find teachers, because they are trained in French, so they masters those meta terms in French. While they are speaking in the national language, they will just shift to the use of the meta term in French because of the inawareness of those terms in the national language. So these are part of the non-didactic functions when we have code switching use. So we have a screenshot of the software, the CLAN output after transcribing. So we can see here when the teacher make use of inter-sentential code switching, and we have the function to make a request. And also the second one, when it is the intra-sentential code switching, when he said, for example, Aye kaye bedatu. So we have the sentence in Bambara, and kaye is the French word which is inserted into this Bambara word. And the correction ke walambala. The sentence is in Bambara, and correction is the French word inserted into this Bambara utterance. That is the intra-sentential code switching. So here they make use of it while giving the request, but at the same time, because of familiarity of saying just the term cahier every time, they will just use it in French instead. So with the meta terms, for example, here when the teacher is saying Ngati la phrase déclarative. Ngati means it is, that is in Songhai. We have been working on two languages, Bambara and Songhai, spoken in Mali. So, and la phrase déclarative, this is the meta term. It is a term which used to explain the language itself. And because of the inawareness of the term in the local language, they will still continue shifting to the use of French while speaking in Songhai, for example. And here the problem is that this is just going to be transmitted to the pupils and lead to the development of a kind of linguistic gap, because the pupils will not have the chance to know what those terms means in their language. So they are dealing with their language without really knowing those terms in their language. So we should be careful about it. So when we try to make a kind of tentative model of didactization of code switching, we recommended its use when it's helped people's understanding the new and specialized vocabulary, when it's facilitates the learning of new content, when it deals with the awareness of people's, the awareness of meta terms, and also when it improves people's participation and promote language production. But we should be careful of its use when it concerns intra-sentential code switchings with meta terms, especially with non-didactic purposes. So the work has been disseminated at different conferences, and we have been able to produce 3 papers sent for publication out of it. So we thanks AAP, the Alliance for African Partnership, and Michigan State University, the University of Letters and Human Sciences of Bamako, my mentors, my family members, and for their support and everything. So thank you for your attention.
Thank you so much, Khadija, too. Next in our group one, and this will be our final presenter for the first group, is Dr. Ijeoma Maduakolam from the University of Nigeria, Nsukka. And I will turn it over to her. And then once her presentation is finished, we will get to our first round of Q&A. So be sure you get any questions in for that prior to the end of her presentation. So Ijeoma, over to you.
Thank you, Justin. I'll be permit me to share my screen from here.
Mm-hmm.
Justin, confirm if you can hear me, please.
We can hear you and I can see your screen, so we're good to go.
Okay. Thank you, everyone, for making yourself available to listen to our presentation. I'll be presenting on the adolescent HIV education module 2 that we developed that are specific for adolescents. And we assess their impact of the tool on their prevention of their unhealthy lifestyle behavior practices. And we also provided voluntary counseling and texting for these adolescents in different schools. However, my work specifically is adolescent HIV, and HIV, we know, is a debilitating infection that targets the T lymphocytes of the body, destroying the immune system of the body. And the worst aspect of this HIV is that it occurs without individual knowing they had the virus. And the issue currently is it is rated as the first leading cause of communicable diseases among adolescents, especially in developed countries. And Nigeria is one of the countries being hit by HIV. Globally, this HIV is 39 million people are currently living with HIV. And the sad event of it is that most of these people live in sub-Saharan Africa. Among these infections, newer infection and erupting most especially among adolescents, and new infections rose in adolescents within the ages of 19 to 24 to a specific number of 480. And looking at Nigeria context, Nigeria in 2021 was rated the second largest HIV bundle, following South Africa. And that has really, the government has worked so hard to bring down the spread. And currently we are the fourth in the world with a prevalence of 1.4, and 1.9 million people are still currently living with the virus in Nigeria. But the sad part of it is that recently the HIV has been shifting. There is a shift, according to WHO in 2023, that there is a shift of acute HIV infection to adolescents. And these adolescents are the vulnerable group, and the vulnerability of this adolescent is compounded by a lot of factors, including the systemic and structural health inequalities that is compounding their issue. Looking at this vulnerability, the motivation to our study erupted from existence of lack of existing policies in Nigeria do not adequately support adolescent HIV and AIDS currently. Most policies in Nigeria are centered on treatment of adolescents who already had the virus, treatments and ensuring that their viral load is reduced minimally. But however, looking at the current spread of HIV and moving to the adolescent between the ages of 10 to 9 years, it's really an issue of concern. So our project and UNICEF also projected that if the current trend of movement continues, that about 183,000 new HIV infections are going to occur in the nearest future if adequate measures are not put in place to cultivate the spread of this virus. Our project focus and mission, we are looking at these specific adolescents who do not have the HIV. We are trying to promote their health, help them to live healthy, help them to adopt a healthy behavior. And we want to know why is it, a lot of studies has been done on this area, but why is it that there are increased knowledge and diseases keep on, spreading within this generation? So we are trying to empower them, with comprehensive tools, knowledge adequately for them to be able to stand and know the difference between the negative side of HIV and how to curtail the spread. And we also are aligning with Sustainable Millennium Development Goal 3, which is to ensure healthy lives and promote the well-being of all ages, including the vulnerable adolescents. However, the approach that our study used in the development of the tool, we developed a HIV educational module. Most modules are structured. Already existing modules are meant for the already infected adolescents. So we are looking at putting considerations of Nigerian context, including the culture. So we looked at the social determinants of health within this adolescent. What are those contributing factors that, affecting their health? We look at the health equity. So the social determinants of health, is a complex factor. If we come to it, looking at the socio-economic factor, we are also looking at the cultural aspect, the belief system. The adolescents in Nigeria do not have access to jobs, unlike here in the developed world. Now in summer, people are having jobs, to keep going. So adolescents in Nigeria and in Africa, I can speak from the Nigeria perspective, are solely dependent on their parents. And the issue of culture, the belief, and conventionally in Nigeria is a multi-sectoral culture that have different cultures. So conventional, some cultures in Nigeria are not allowed to discuss, adolescents are not allowed to discuss the sexual matters openly. These matters are considered unmentionable, distasteful, unpleasant, such that information is considered secret until marriage. So you see these adolescents, when they are raped, some of these adolescents we come in contact with do not seek health care. Some of them that tested positive in our voluntary counseling confided is not part of the question, the instruments we measure, but they confided they were raped and they couldn't open up to anyone to seek for help. So looking at the social determinant, we put it into conception in development of this specific model, and this model is going to be published, it's been sent for publication. So we used this model development was guided by theory of planned behavior. So the two approaches put into consideration their attitude, the subjective norms, and their perceived behavioral control. We also look at the provision of on-site voluntary counseling, because voluntary counseling is not free in Nigeria. There are not adequate policies on, putting up this counseling for these adolescents. And these adolescents, there are no insurance coverage for them. They cannot, and the policies, some of the policies we have are enacted for adolescents between the ages of 18 and above, or adolescents who had already married can access sexual matters. So these ones between the 10 to 19 years is really a vulnerable group who cannot speak up, who cannot access health, who dependent on their parents for. So we developed this model. So for the development of the model, we use a Delphi process approach. In that Delphi process approach was a modified Delphi process approach was guided by theory of planned behavior. So the specialists we recruited 6 specialists through a confidence sampling in various ways. We recruited the counselors, HIV counselors, the community health nurses, the nurses, and all the specialists were involved in development of this model 2 for teaching the adolescents. And specifically for our work right now, we are looking at adolescents in secondary schools. And part of the project after now, we are going to look at the out of school adolescents, the communities, and the home adolescents. Now for the design, what we did, basically, our study is an interventional study. It is a quasi experimental. The 2x2 factorial design, meaning that we had 4 different schools. We have the experimental and the control group. For the experimental group, each group will have both urban and rural population. So we want to, categorize these adolescents to see if location, if where they are located is a problem to them. So we try to look at this. And before then, we provided the on-site voluntary counseling in all the centers that the study was conducted. All times for AAP for sponsoring of and that was huge spending in purchasing and everything. So we before the baseline data collection, so the voluntary counseling and testing, a mobile tool was provided to them in the center, and they were informed, both the control and the intervention. Then a baseline data of information was collected from adolescents. And after that, the other group, the intervention, which received the treatment, which received the tool we developed, we administered, commenced 1 week after that. And the teaching took place like we have a specific method of teaching. We use a student-centered approach, which we, there is, if you watch the videos, you see the interactions that went on between us and adolescents. You see a lot of them speaking up, asking questions. They are not allowed to ask their parents or relatives. They are shying in to speak up. So, and the sample we use, and after the delivering of the module and the intervention, 2 months after, we collected the data for all the group, for both the intervention and the control group. And we have the sample we use is the 643 adolescents. So there we are, we have the intervention having a higher number and the control group having a higher number. But we use a multi-stage sample because it entails different stages, both probability and non-probability methods was used. But for the testing that we provided in our center, we used a rapid kit, HIV test kit, the Unigod and Datame was used, and we used the starter pack to confirm. For those that tested positive, it's really sadly that some of these adolescents actually tested positive, and almost 18% of them did not know they had the virus. And out of that, you know, it is also sadly to explain that these adolescents did not actually know a lot of things that is causing HIV, but they actually know what HIV is all about. So for the teaching, we used information, education, communication material to consolidate our learning, such as posters, video, and we had a role play, you know, teaching them. They are the one that acted the role play. We taught them, and this in order to consolidate learning and make learning easy for them. So for the data analysis, and because of time, we used both inferential and statistics, and we use independent tests to compare the differences in the odd ratios, and we also use logistic regression model to also compare the differences in their locations. So for the results, looking at this, you can see the comparison. This work is huge, and I'm presenting some very few part of the work. The baseline information now. This is the control group. You can see the control group received no educational tool. The tool we developed, and the intervention group who received this tool had the blue side, adequate knowledge. Now, the problem is that most studies have been done in this area, but these adolescents like the basic information on knowledge of transmitting of HIV. These adolescents believe that once you are my uncle, my brother, or I'm intimate with you, I can go down with you. You are HIV negative. The trust is built because of I love you. You had that. You are not HIV positive. So looking at the baseline for the two groups, both intervention and the control group, have a very poor knowledge of HIV. And post-intervention, the intervention that had our tool improved greatly. Now, participants attributed the cause of HIV as spiritual. Now, looking at the social determinants of health, culture plays in our findings. The cultural belief, the belief that HIV is a spiritual. Even in the discussion, in the teaching model, a lot of them attributed the cause of HIV as a spiritual. So now looking at the main point of our project, which is on health, we want to prove their behaviors, you know, because these adolescents cannot speak up. They can't seek for health information. The unhealthy lifestyle behavior in both groups was very, very bad. Let's look at it, up to 73.4 for the control and 72.9% for the intervention. Looking at this, you see a lot of them see that engaging in unprotected sexual intercourse is normal. For HIV, we are not saying you shouldn't have sex, but the point is protect yourself. If you are going any type of whatever we are doing, let there be a protection. Or if you need to, you know, get married, you go for testing. So using drugs was common among them, and sharing needle, which is not a big deal. So these adolescents believe that once it's my uncle, they could share needle, or anyone they have intimacy, they can share needle. And looking at our social determinants of health, which is considered in the tools we developed, it is not essential to discuss openly about HIV. They're seeking health information, which is the goal and our vision to make them know the actual causes of HIV. And now looking at this, significant differences also existed between the male and female adolescents. Now, in Nigeria, from the study we conducted, female have been associated with more risk. And sorry to say this, most female tested more positive than the boys in our findings. Now, considering the overall use of voluntary counseling and testing, it was also low in both groups, but improved greatly. From the graph, you can see the blue, 81% of the intervention used our voluntary counseling. Although in the control group, about 24.7%, we are able to use it without receiving the information. And the more people for the HIV testing, 21% of the adolescents tested positive in the control group. And you remember the control group did not have the educational tool. So what we did was, after the whole program, we make sure we use the tool to also consolidate the learning in them. For the intervention group also, 19.8% tested positive. Now, receiving intervention and having good knowledge significantly predicted the use of voluntary counseling. So we are advocating for policies to make voluntary counseling and teaching in secondary schools to be part of their curriculum. Now, looking at the predictions, the prediction of use of voluntary counseling, most of adolescents in our findings shown that the use of none of them demonstrated that they can go to hospital or seek for voluntary counseling. None. Only those who have tested before are those who were sick some time ago, and doctor requested for them to go for HIV testing. Now, the use is significantly, the predictors of use is likely, the predictors are location. Those in urban are 20.4 times higher in participation in use of voluntary than those in the rural. So location become a problem in this. The predictor of use again is group. The group of participants in the intervention were able to use voluntary counseling and testing. Now, this is after the intervention. Those of the adolescents in the intervention group came out. You can see them queuing up to take voluntary counseling and testing. In conclusion, the tool we developed was significantly in reducing the unhealthy lifestyle behavior, and it's majorly corrected misconceptions and false beliefs and promoted the use of voluntary counseling. So we are advocating, right? The papers have been presented in 3 conferences and be sent for publication. The tools will soon be published. And we are advocating for HIV education module to be our tool to be integrated in secondary school. As the next phase of our project is to look at out-of-school adolescents to see what is going on out-of-school adolescents. And we are also advocating for free and affordable voluntary counseling, to halt the spread, since there is a shift from adults to adolescents. Free and affordable adolescents should be made available in all schools in Nigeria to halt the spread. And enacting policies on adolescent HIV is the way to go. And more importantly, some of the adolescents that tested positive to our findings, out of them, 3 came to us to tell us they were raped. And when being raped, they didn't seek for healthcare. This is an issue. Looking at the social determinants, cultural belief, and the issue of adolescents and not due to cultural reasons could not speak up when they are supposed to speak up. I want to thank the Michigan State University, the AAP for this opportunity, and my university, University of Nigeria, the Lion. I want to thank them for the opportunity, and also want to thank the College of Nursing led by Dr. Lee, Dr. Buho, Dr. Krista Walker, and my able 2 mentors. I have 3 mentors, Dr. Angela, Dr. Rhonda Konawara, and Professor Jomo Koronko from University of Nigeria. And my research assistant, Dr. Ifeoma Dubisi, and all the schools we conducted our studies. Thank you very much. For those that would love to collaborate with us, we would like to extend our research work to other Africans to look at what is going on there. Thank you very much for listening to the presentation.
A big thank you to our presenters for such informative and insightful presentations. Just to catch up with time, we'll go straight to the Q&A. We gathered a few of your questions through the Q&A feature, and I'll go straight. I'll just read them out, and then I'll hand them. I'll give it out to the presenters to answer. So in the order of presentations, Dr. Lesedi Mashumba, these are your questions. First one from Max Chuhila. It was his question about was paying informants. How did that affect the quality of your data collection? And this one coming from Fatumata Keita, still on the Basarawa people. Are there any reparation measures taken by the government to address the conditions of the Masarawa community? So those two questions for you, Dr. Lesedi Mashumba. And for you, Dr. Queen Orwa, first one coming in from Joyce. She says, what would be the shortcoming with using Kiswahili, which is believed to be spoken and understood by all citizens of Kenya? And from Rehema Mwakabenga, she says, to what extent is Luo used to raise awareness about NCDs? In some places, native language is used to get many people for screening and reduce the magnitude of the problem. What was the situation in your study? And for you, Dr. Kadidiatu Ture, question from Michael Daramora. He says, what are the previous studies in this area and what are the existing gaps that require further studies? And last, but certainly not least, for you, Dr. Chioma Maduakolam, Lucien Sungen says, how did you identify the social determinants of health to input into your model? And Michael again says, you mentioned that a lot of work has been done, but still the problem persists. What do you think could this attributed to, and how do you think your findings could be implemented to alleviate this problem? And he also asks, what is the contribution of religion settings towards educating this group of individuals in Nigeria? So those are your questions, our panelists. We have 10 minutes for this Q&A. So if you could speak, you could stick to time. Let's start with you, Dr. Lesedi Mashumba.
Thank you so much, our moderator. All right, the first question from Max. Yes, there was compensation or payment that was done to participants, which was $10. We used an equivalence of 1 to 10, which is 100 bula in Botswana. But I also have some published work in research ethics, and I believe that amounts that we use to compensate participants must actually be enough to compensate for their time, but not too much as to coerce anyone with a reasonable mind to participate when they would otherwise not participate. And in the information sheets, we had disclosed that we are going to have compensation, but we did not state the amount. So it was only at the end of the interview that we actually compensated the participants. And actually, we had participants that turned down or declined participating because they believed perhaps we were sent by the intelligence services and we were going to snitch about their activities in the community. So they refused and said they don't want to be jailed tomorrow for the things that they said, which also showed that indeed compensation of participants didn't influence their decisions to participate. Then Michael asked about the research questions, and some of the research questions we had were, what's your understanding of the terms development and modernization? So that we wanted to understand whether they comprehended those, whether they carried a certain meaning, whether they could evaluate development from where they were to the new resettlement areas. This was followed by a question of describe how your life was in the CKGR prior to relocating. And they described how their life was prior to the relocations. Now, the third question was the most packed one, because this is where we now wanted to assess whether modernization and development had really taken place, since the government has justified its actions that it was doing this to modernize and develop them. So we asked the question, assessing the current way of life that you have now, would you say you've been modernized or developed? And we would probe further into looking at access to education, the development indicators, using the development indicators, access to education, healthcare, social amenities, economic development, access to justice and human rights, as well as future prospects for youth, because youth form an important part of community. Then Fatoma asks about reparations. And may I just correct you there with the word you used, Masara. It's a derogatory term that is used by farmers in the Khanti area who tend to feel they own some of the Masara people that work for them. So it's a very insulting and unacceptable term. We use the concept Basara peoples to acknowledge them and accept their indigeneity. So yes, there were reparations, but the Basara people said they did not deem those as enough. And some families said they were still actually waiting. So each household was given 5 livestock, that is cows combined with goats. And they were also given support to start businesses. The government constructed some industries for people to do textile and carpentry work, which unfortunately, when you visit these resettlement areas, every business has closed down because they are very far. They're in remote areas that are very far from any business markets. So even if you were to fund those businesses, they wouldn't have a chance of survival at most. And they were also told they'll be given hunting licenses to enable them to hunt for their families. But one of the things with the health indicator assessment, we found that they actually had a high protein deficiency, and they actually narrated that the lack of hunting licenses, which the government long promised in 1997, was part of the reason why they were not eating well. They were not eating a balanced diet. They are not even planting, because tilting or tilling the soil is actually against their culture. It angers the gods. So even if the government says we've given them seedlings and seeds to plant or to plow for their families, they can't even engage in that type of agriculture because it's against their cultural and supernatural beliefs. So yeah, it's a lot that goes with the reparations that were availed. So thank you very much.
Thank you for that. Let's move on to Dr. Quinn.
There were a couple of questions. One was asking on the shortcomings of Swahili as being the language that could be used in sensitization in non-communicable diseases, and that is very true. I wish it did happen, but remember that Kenya has got it's linguistically very diverse, and so it comes to play matters of regional and cultural diversity, where so many languages are spoken. And while Kiswahili is widely understood and is a national language actually taught in schools, it may not be the primary language for all communities. Some regions would prefer their local languages to better understand the dynamics and management of NCDs. But at the same time, health literacy limits. Remember, these type of diseases we are talking about are not discriminatory. They cut across all ages. So whether you're learned, gone to school, or illiterate. And therefore, although Kiswahili is broadly spoken and variations in literacy level exist across different regions of Kenya and its demographics, and therefore, still the element of doctor-patient communication can only be effective if there's trust being built. And a lot of times you can only build trust with a person that you know. And when we talk about linguistical trust, then we are talking about Swahili is, well, widely accepted, but a lot of times local language spoken by the community can enhance trust and improve patient-provider communication, which at the same time will actually now help in the diagnosis, screening, and treatment, and even adherence of the disease. Having talked about that, there was a second question regarding to what extent awareness has been created. There was a question that I didn't actually address. There were some other findings. When we ask the respondents, are there instances when we ask the respondents about the mode of communication that they would prefer the Ministry of Health to use in disseminating or conveying information on cancer or non-communicable diseases, 51% of the population subscribed to use of radio. No, use of radio. And then 73% also preferred nationally the use of radio FMs because that is what is commonly used within the environment. And 10% chose to, actually 5% nationally advocated for the use of the television, and 19% at the county level also looked at the television. But then in terms of dissemination, sensitization of the diseases, it is very difficult. It hasn't reached the rural areas, and basically it's because a lot of literature is not in the language that people understand. And so efforts is done by the government at the moment and NGOs through the radio channels, because a lot of local FMs or local dialects are disseminated through that media, but not everybody can afford the cost of electricity. So that brings to play the socioeconomic factors. And so it's work in progress.
Thank you, Dr. Olwa. I'll move on to Dr. Ture. I will lean on you because we need to move on with time. Please go ahead.
Okay, thank you. So for the question, I think we have a lot of work done in the area, both on language planning and bilingual education worldwide, not only in Mali or in Africa. We don't have too much in Mali. But the thing is that because since after independence, people have been thinking about language policies, which language policy to adopt for us, the new independent countries in Africa. And it is in this sense that some countries like in Mali have been just officializing the colonial language, French, which was a ready one for us compared to our local languages. But things are changing. And now with the officialization of our national languages, what are the future studies is that we can see the government is trying to respect or to have this linguistic diversity in the policy, which is really good and that people acknowledge. But nowadays, we should go beyond that. We need, those languages have different, I don't know how to say, different exposure. They are used differently. And also, every community, each of them wants to be identified through its language because it is a means of identification as well. So in this sense, those policies should not only have this general view of things and this neutral attitude, because the language planning has been qualified by some researchers like Calvet as a kind of neutral attitude. The government is just saying, okay, all of those languages are now official languages, and just leaving the languages impose themselves by their dynamism and through who has the power to do what. And this is not really language promotion. If it's be to promote all those languages, it's to look at what this language X need, which may not be what this language Y need. There is one language which is maybe the only instrumented one, the one in which all efforts are done, whereas we have those other languages. Still, in terms of status, they have been given the same status, but in terms of function, it's not the case. They are not going to have the same functions. And by the end, as I have said, some will be endangered languages and disappear full time. So in terms of future studies, that's what I have been trying to do, to look at beyond the policy, which said, yeah, the 13 languages are officialized, but what does it really mean in practice? What is happening to those languages? So looking at the practical aspect of it, of the policy, what comes after we have those law promulgated. And for the language, the bilingual education, also at the very beginning, in the classroom, it was said that the languages should be kept separately. For example, you will have some modules in French, some modules in your mother tongue, and so on and so forth. So, and again, it has been criticized, as you have said, what were the previous studies? So it has been criticized a lot because some have called this as a kind of parallel bilingualism or separate bilingualism, because the two languages in a way or another within the classroom context will come into contact. It is part of the whole process. So languages get into contact. And that's why now I have been looking at code switching in particular during this research work, because we have a curriculum, the bilingual curriculum, which look at how those languages should be organized. So they are given average. For example, for in the language course, you will have 20% or 50% in grade 1 of your mother tongue. In grade 2, because it is a transitional shift to French, the number of percentage will be reduced. So it's just organizing them and giving them a kind of percentage. And also after that, they have been trying to look at the how to integrate the meta-linguistic activities, because we have seen that those peoples, they may think in their languages first and then trying to speak or to display the same feature in French. So looking at the meta-linguistic activities to improve their language acquisition. So for future studies, again here, I think it's better to look at how to integrate this code switching. Code switching is known and we are doing it outside and everywhere. So how to integrate it like a part of the curriculum, or as I have just called it, the didactization of code switching into the bilingual classrooms. And that may help both teachers and pupils. So yeah, that's what I think.
Thank you. Thank you for that. Again, last but not least, Dr. Ichioma, please take it away.
Thank you. My first question was, how did I identify the social determinants of health? Social determinants of health are those disparities or health differences that adversely affect the vulnerable populations, which are the adolescents, So how we determine it, we looked at studies done previously. Most studies, there are limited interventional studies like this one in Nigeria currently. Most studies, we are basically a descriptive cross-section assessing their knowledge attitude. But our own study was kind of different. We look at the social determinants. We are looking at the social determinants. What are those determinants of health that, such as, like I said, the socio-economic factors, like accessibility of HIV information to adolescents. Now we looked at the schools. Most of the health information they have is on sexual health, which is menstrual hygiene practices and all that. Looking at it, they mentioned HIV, but it was not at the roots. So we looked at these are determinants that helped us in developing our model 2. Also, we looked at income level of adolescents. Are there voluntary testing for these young adults? So this is how we determine the social determinants of health. Coming to look at my second question, which is very important, and I appreciate the person that asked this question. How do I think my study will make impact, since there are other studies that we have done? Like I said, there are limited study on interventional studies like this. Remember, we provided voluntary counseling in all the schools that we conducted the study. And now we develop a tool that is specifically structured for these adolescents. It is peculiar to adults, not just, if you go to, most tools developed are just for HIV, generally for those, but this tool is specifically for adolescents who are not living with HIV, and probably if contacted with the virus, how to also live, to live healthy. Then looking at my third question, the role of religion, that's a more difficult one. Nigeria is a multinational country, and our strength lies in our diversity and the religion has really played a deeper role in my country. So we are looking at the next phase is to incorporate different people from different religions to make this tools to get to the roots. I think I've been able to answer the specific questions. Thank you.
Yes, you have. Thank you so much, our panelists. I'll let Justin take it away with the next set of presentation. But I want to encourage you to continue interacting with the audience in the Q&A. I see that Queen, you still have a question there. You can go on there and answer that. So, Justin.
Thank you so much, Tony, and thank you to our panelists. Let me move on to our next group here, group 2. So first up, we have Dr. Koumba Niang from the University Cheikh Anta Diop in Senegal. Dr. Niang, I will turn it over to you.
Sorry. Hello, Justin. Do you hear me?
Yes.
Okay, let me share my screen. Okay, do you see my screen now?
Yep, looks perfect.
Okay, thank you very much. Good morning, everybody. Okay, my name is Kubanyan and I'm a research scientist in the University Cheikh Anta Diop in Dakar. So my work, I will be presenting my work which is titled The Influence of Madden-Julian Oscillation on precipitation, extreme weather events, and its state-of-the-art climate simulation, historical simulation over West Africa. So West Africa is known to be particularly vulnerable to climate change due to the high climate variability and the high reliance on rain-fed agricultural and also limited economic and institutional capacity to respond to climate variability and changes. So the large part of West Africa has been witnessing increasingly severe extreme weather events, particularly flooded, as it is shown in these figures. So the observation of this flooded over Senegal here and also in Nigeria in 2022 is the perfect illustration of the consequences of these events, which often devastated most economic, social, and environmental systems of the region. So the latest Intergovernmental Panel on Climate Change report show that the climate warming induced by anthropogenic forcing is expected to alter the precipitation in global land monsoon region with an increase of the frequency of these weather patterns. So this increase, it constitutes a threat to the livelihood of human, and it is posing some serious challenges to infrastructure planning over this region. So some studies, they have shown that the West Africa region is very sensitive to the anthropogenic climate changes with some substantially more intense extreme precipitation in the future projection. And in addition to that, some deep research into extreme precipitation over the region is very scarce. So, however, the detection and projection change in these weather patterns on regional scale, they remain highly challenging and uncertain. So to better mitigate these events and provide information on future changes in terms of adaptation, so it is crucial to fully improve the estimation of these extreme precipitation over the region, and that highly require the understanding of the key drivers of the extreme weather events. So as one of these key drivers, we have one of these key drivers is the larger scale mode that we call the Madden-Julian oscillation. This phenomenon constitutes the most dominant mode of intra-seasonal variability over the tropical atmosphere, and it has a wide range of impact affecting precipitation and atmospheric circulation around the tropics and subtropics also. So it is defined as large tropical atmosphere convective cells, which is characterized by an area of deep convection, flanked on both sides by area of dry sinking head. So this equatorial traveling pattern of anomalous rainfall is a planetary in scale, and it is characterized by two parts. One part that we call the enhanced convective phase and another one that we call the suppressed convective phase. And as it is illustrated in this figure, so we see that here, the surface and upper atmosphere surface of the MGO for a period when the enhanced convection, which is associated with thunderstorm cloud, it is centering here around across the Indian Ocean. And the suppressed convective phases is centering here around the West Central Pacific Ocean. So this entire system, they tend to shift eastward over the time, circling the globe and returning to its original point. So, for example, here in the suppressed convective phase, we have seen here in this figure that wind tend to converge at the top of the atmosphere, forcing air to sink, later to diverge here at the surface. And as air is sinking from high altitude, the altitude is warm and dry, so which suppress the rainfall pattern. So very few work have been done trying to understand what are the link between the MGO events and extreme weather events, and also the mechanism through which that impact take place is not really understood. And in addition to that, the state of art of models have shown that the MGO could be predicted 2 or 3 weeks in advance, and given the increasing skill of numerical model for its prediction, this pattern could provide a very good potential source of predictability for these extreme weather events. However, it remains unclear how these changes in MGO could induce the extreme in response to future warmings. So the objective of this work is to assess how the MGO changes in response to anthropogenic greenhouse gases increase could affect the occurrence of extreme weather events over the region, and then improve our understanding of the process that contribute to the predictability of those weather patterns. And these are the research questions that we are trying to answer through this work. And for this work, a large amount of data have been used, including observational data from different centers, as well as climate simulation data set. And here we are showing just an overview of the SEMIP6 historical model that we use, with some information related to the modeling institution, the atmospheric resolution, as well as the countries. So for this work, so we have defined an heavy precipitation events as those precipitation are exceed or equal to exceed the 95th percentile of daily amount. And for the MGO analysis, we have used a similar approach proposed by Wheeler and Hendon, which is mainly based on a combined empirical orthogonal function analysis that have been performed on 3 combined variables, which are the zonal wind at different level, and also the outgoing long wave radiation, which is considered here as a proxy of convection. And once this analysis is done, we have used the first COF to describe the MGO activities, and in order to follow the growing and decaying stage associated to this event. And the same procedure will be followed for the model simulation. So I'm going to show you some of the results that we have gone so far. So here, first of all, we have tried to look at what are the observed impact of MGO on rainfall pattern. So here I'm showing the evolution of the MGO mode through the different phases. So I have to mention that the MGO is classifying into 8 phases. 8 phases that are based on where the enhanced convection effects are occurring geographically. So this MGO produces here a relative coherence of enhanced convection when traveling across the West African at phase 1 and 2, which is considered here as the enhanced convective phases. So this convection, as it is traveling, so this convection becomes very weak across favorite part of Western Africa at phase 5 and 6, which is considered here as the suppressed one. So this figures is showing that there is a clear evidence that the MGO is influencing the rainfall pattern by favoring strong rainfall during the events, while the opposite is observed during the suppressed one. So now looking at the modulation of extremes, so we have noticed here that during the enhanced convection phase, likelihood of having extreme precipitation events increased to a value of 50% over the Western Sahel and a significant value of 100% here over the Guinean region. So we have noticed that also during the suppressed phases, we have noticed a reduction of 20% in the probability of having extreme weather events over the western side of Sahel. And this value can go up to 80% over the orographical region here, like the western part of Nigeria. And this is associated with a very significant decrease. So we have observed here that there is a clear MGO cycle, so in extreme precipitation. And the changes in extreme precipitation frequency are strongly dependent on MGO phases. Now, so regarding the mechanism that could explain that connection between the MGO and extreme. So we have examined how the moisture transport gives rise to the MGO-related precipitation extreme. So we have still focused on these 8 phases of MGO. And here we see that during the enhanced phases, the West Africa is dominated by the presence of a trough, which is in which the moisture transport here during that period, they tend to bring moisture from the Western Atlantic Ocean toward the region. And this moisture supply tend to favor an increase of extreme precipitation. While during the suppressed one here, we have observed a reverse configuration. So what we can notice in this analysis is that the MGO is much greater in the area where the main moisture transport mechanism occur. And in addition to that, the analysis have shown the existence of a contrast between the Indian Ocean over this region here and the West Africa. This is very important because it might be used as a potential predictor, since some studies in the past have shown that there is a time lag of about 15 to 20 days between the two regions in terms of anomalous convection. So for the next part, so we are going to run the same analysis, but using now the semantics historical simulation model. So for this one, we are trying to see how well this historical simulation are capturing the main characteristic of the summer MGO and then its influence on extreme weather events. And first of all, we have evaluated the model skill in simulating the SWAP propagation associated to that pattern. So to objectively quantify the model skill, so we have used here the pattern correlation that are calculated over the time longitude, the domain of West Africa between the simulated rainfall evolution pattern and the observed counterpart. So this approach, it seems to provide a comprehensive evolution of models by classifying so the models into categories. And among the 23 total simulation, we have seen that 8 models. These 8 models, they exhibit a superior skills in simulating these the SWAP pattern associated to the MGO with pattern correlation exceeding 0.5. We then identify those 8 models as good models, which is representing 35% of the total amount of models. So 8 models with the pattern correlation now ranging from 0.4 to 0.5 are identified here as an intermediate model. And the 7 models with the lowest pattern correlation skill as poor MGO model, which roughly representing 30% of the total amount of simulation. So here we see that this skill core provide an objective measurement of models performance, allowing for systematic now comparison between the different models. So for the next part of this analysis, so it will be mainly based in those 3 categories. So looking at how the MGO now simulate the likelihood of extreme weather events here. So the analysis here, we are just summarizing the result because of matter of time. We are just summarizing the output. So here we see that the analysis shows that in the model that the MGO continue to represent a great challenge for these latest generation of GCM models. So basically, most of these models, they are able to simulate a clear MGO cycle in extreme precipitation, so a large impact in this occurrence. during these the enhanced convective phases, the model have shown that the likelihood of extreme precipitation events was well simulated in good models, because we have noticed an increase of extreme of about 40% compared to the 50% that we have obtained from the observation. But we have noticed here that there is less coherency in the intermediate and poor model. So regarding the mechanism, so if you remember in the observation, we have identified a mechanism in which the West African region was dominated by a two, in which often extend from the Western Atlantic region, bringing large amount of moisture into the region land. So that moisture was tended to favor an increase of extreme precipitation. So that mechanism, we are trying to look at in the model, how well is it represented? And we see that this mechanism is very well represented in the good model, while the intermediate and poor one was not able to show a very clear signal on how this moisture transport give rise to MGO-related precipitation. So for the conclusion, so we have seen through this work that there is a clear evidence that the MGO is affecting the rainfall pattern as well as the extreme weather occurrence because we have noticed a very clear MGO signal in that pattern, and that the changes of extreme weather events were strongly MGO phases dependent. So the link between atmospheric moisture transport and extremes have shown a very clear relationship. And we have seen that the MGO was much greater in area where the main moisture transport mechanism occur. And in addition to that, we have noticed that the existence of a dipole between the Indian Ocean and West Africa, which is very important. As I have mentioned earlier, it could be used as a potential predictor. So into that, we know that there is an anomalous in terms of anomalous convection, there is a time lag between what is happening in the Indian Ocean in West African monsoon system. And regarding now the models, so we have seen that there is a very good skill in 1/3 of the model in simulating the SWA propagation of the MGO, as well as the teleconnection with extreme over the region. So the mechanism behind that teleconnection was also very well simulated with the good models, but we notice that there is less coherency in the others. And so in general, we have seen that some of the SEMIP6 model, they suggest a potential to predict the occurrence of extreme weather events over this region. The MGO could be realistically predicting, aiding in better preparation for such events. So now for the perspective, so we are looking for to analyze now, since we have already seen that there is a connection and we have identified the mechanism that take place. So now we are going to analyze how the influence now this MGO will involve with increasing atmospheric greenhouses using some global warming scenarios. And this will allow us to evaluate now the impact of these future changes on the societal vulnerability and population, and quantify the associated risk to the level of global warming in order to propose some mitigation strategies. So this work have been supported by the MSU through the AAP program, and we thank our mentors, the AAP staff, the staff at the Department of Geography, Environmental and Spatial Science, as well as the Laboratoire de Physique de l'Atmosphère et de l'Océan, Simeon Fonga, in our home countries. And we also thank our family members. So thank you for your attention.
Thank you, Kumba. It was a wonderful presentation. Moving right along in our Science, Technology, and Innovation group, I am going to ask Dr. Tabitha Amolo to give her presentation. Oops, there we go. Dr. Amolo is from Egerton University in Kenya, and I will turn it over to her.
Thank you, Justin. I just need to share my screen in a minute. Okay. So like Justin has introduced me, I'm Tabitha Mulo from Egerton University. Today, I'm going to make a presentation of part of the work that I've done in the past year at MSU. And the title of this presentation is Ion Beam Assisted Magnetron Sputtering for the Development of Solar Energy Conversion Devices. So this research explored technology for the fabrication of solar cells, which basically converts solar energy to electricity. And in figure 1, showing a schematic illustration of a perovskite solar cell. So perovskite solar cells are among the high performance emerging solar energy conversion technologies. As of current, they exhibit the highest efficiencies in tandem structures. So in this figure, I want to point out that it is a complex structure that is constituted by many layers. So we have the selective contact, the whole transport layer, the perovskite layer. This is usually the photoactive layer. There is an interlayer and then electron transport layer, and TCO. TCO is transparent conductive oxide. So this device structure cuts across most of the solar cell types. And when a solar cell is under illumination, that is when a solar panel that we are all aware of is exposed to sunlight, what happens is that the solar energy, or in layman term, the rays of the sunlight penetrate the device to the photoactive medium, which in this case is the perovskite. And upon absorption of photons by the photoactive medium, excitons are generated. So these are your charge carriers, the electrons and the holes. So what happens is that the holes are transported through the whole transport layer to the contact, and then the electrons are transported through the electron transport layer to the TCO from this diagram. And then this device is connected to the outside circuit, which is your typical load, and you have your electricity. So, like I've mentioned, that the perovskite solar cells are among the high-performing devices of solar cells currently, but there's a challenge with their commercialization because they suffer from instability. So the perovskite itself, which is in the photoactive medium, is chemically unstable, and also it's thermally unstable. It also degrades upon illumination, UV illumination. So that is a challenge in that to do industrial manufacturing or large-scale manufacturing, there need to be technologies that are suitable for the fabrication without jeopardizing the device structural stability. So in this research, like I've mentioned, we are exploring or developing a technology that can be used for industrial manufacture of perovskite solar cells. So basically, we want to enable the transition of laboratory research scale to large-scale manufacture of these devices. And I'm going to present part of the work. So like I've mentioned, there are many layers, the TCO, which is the transparent conductive oxide, the transparent electrode, so to speak. So in this study, we optimized the thin film growth of the transparent electrode, and commonly indium doped tin oxide, abbreviated as ITO, is used because it has superior electrical and optical properties. Let me pause here and explain something on the transparent electrode. So it is the layer through which the sunlight penetrates the device. So that means that it should be transparent enough to allow the photons to be transmitted through to the photoactive medium. That's why we are saying that it should have high optical transparency. But because it's an electrode, it is also supposed to have high electrical conductivity. Now, the ITO is scarce and so are relatively expensive. So we explored a different TCO material, and that is tantalum doped tin oxide. So basically, the indium which is used to dope the tin oxide is the scarce material. So we want to use, we want to use the tantalum. Why tantalum? It has an ionic radii that is close to that of tin oxide, and therefore it can be substitutionally doped into the tin oxide lattice without distortion. So we did the optimization of these two TCOs, that is the ITO and the TTO, and then we determined the properties of these thin films. And that is what I'm going to present today. It is part of the work that I did. Now, apart from photovoltaics, where the transparent electrodes are used, there are other many applications of TCOs that is include light emitting diodes that I believe most of us are conversant with, and the flat panel displays that are used in many ways for visual displays. And then they're also used in smart windows, which the optical properties can be tuned on application of a voltage so that it can either be opaque or transparent. So on the methodology, like I've said, we were looking at a technology. So the ion beam magnetron sputtering in this figure shows what the technique looks like. So typically, this is the deposition chamber where the thin films were grown. So in this deposition chamber, there's the sputtering magnetron, and then we have the ion source, and then we have the substrate stage. So this way, the substrate on which the thin film is grown is placed. Now, the ion source and the sputtering magnetron are inclined at 45 degrees to each other. And what happens is that when the plasma and the ion beam hit the substrate, then the atoms nucleate on the substrate to form the thin film. There are many parameters that influence the growth of the thin film, and they include magnetron power, ion energy, ion flux density, temperature. This is the substrate temperature, the oxygen concentration, because these are transparent conductive oxides, the deposition angle, and the gas pressure. So for this research, we did optimization of the parameters from number 1 to number 6, but we used constant gas pressure. So the chamber was maintained at a base pressure of 2.67 times 10 to the power negative 5 pascals. And the process pressure throughout the depositions was maintained at 0.4 pascals. The process gas was oxygen in argon. Now, the magnetron was maintained at a 70 watts pulse DC with a pulse frequency of 100 kilohertz and a 1 microsecond of reverse time. That is throughout the depositions. Okay, for all the results that I'm going to present today. The ion source was excited using an RF radio frequency and direct or a DC voltage. So the RF was maintained at 10 watts for the results I'm going to present. And the DC voltage was varied between 50 to 120 volts. Now, the targets used for the ITO is the indium oxide, tin oxide at 90 to 10 weight percentage. And then for the TTO is the tin oxide and tantalum oxide at 97.81 to 2.19 weight percentage. The deposition was optimized in such a way that the films were maintained at 100 nanometer thickness for the results I'm presenting today. On the results, I'll start with the ion beam characteristics, and in figure 2 shows that the ion energy has a narrow energy distribution, and the peak of this energy is dependent on the DC voltage. Figure 3A shows that the ion energy is directly dependent on the DC voltage, but not necessarily on the RF power. And figure 3B shows that the ion flux depends on both the DC voltage and the RF power. Now, these are important because these are part of the parameters that influence the thin film growth and the ultimate thin film property. Now, on to the thin films that were deposited. So we have the ITO thin films microstructure shown in figure 4 and figure 5. So in optimizing the deposition angle, the ITOs were grown at inclination angles of 30 to 90 degrees. And that is with respect to the magnetron, that is the angle between the substrate and the magnetron. So what is observed here is that at 30 degrees and 45 degrees, the thin films are more crystalline. They are crystalline, so to speak. They are the 222 and the 440 plane of indium oxide that are observed. At 60 and 90 degrees, the films are kind of amorphous. And you look at the influence of the ion source on the thin film growth, it is realized that with the ion source, the films are crystalline, while without the ion source, they are amorphous in nature. Now, for the TTO, the tantalum doped tin oxide microstructure, in figure 6A, the films developed or grown at 100 volts and 120 volts are crystalline. Actually, they're polycrystalline with small peaks of tin oxide, while the films grown at 50 to 80 volts DC voltage are kind of amorphous. Again, the ion source promoted the formation or promoted the crystallization of the thin films, while without the ion source, the films were amorphous in nature. This is important because the crystallinity of the sample influences the other parameters that we are looking at, that is the electrical conductivity and optical transparency. And then, like I've mentioned that the transparent electrode should be highly transparent. So figure 7 shows the optical transmittance of the ITO films. And the first thing that's observed in A is that the transmittance increases with the oxygen concentration. This is typical of TCOs. And in figure 7B, the films that were deposited at 60 degrees had the highest optical transmittance of 90% in the visible region, although all the films exhibited high optical transmittance. For the TTO, figure 8A, we see that the optical transmittance increases with the increase in the DC voltage. And this is because the ion source amplifies the delivery of oxygen species at the substrate during deposition. And the higher ion energy will mean that more of the oxygen species are delivered, so that there's a higher optical transmittance at higher DC voltage. Figure 8B shows the influence of the ion source on the optical transmittance of these films. And what is observed is that at about 400 nanometer wavelength, the films deposited with ion source has a higher transmittance than that deposited without the ion source. But from around 550, the two films have the same optical transmittance. Now, to the other key property is the electroconductivity, and table 1 and table 2 shows the sheet resistance of the ITO films and the TTO films, respectively. Now, with respect to the deposition angle, the films that were grown at 30 degrees showed the lowest sheet resistance, that is 62, followed by those grown at 45, which is 71 ohm per square. Then, for the TTO films, the sheet resistances are listed with regard to the ion source voltage, and it's observed that 60 volts, the films grown at 60 volts, showed the lowest sheet resistance of 419 ohm per square. Another thing that was observed here is that when the substrate was heated, that is at 200 degrees Celsius, this same film that has exhibited 419 ohm per square now exhibited 580 ohm per square of sheet resistance. Now, in conclusion, the ion beam assisted magnetotransportering produced dense and crystalline ITO and TTO films at room temperature. And that is what the research set at. That is, we wanted to find a way, a method or a technique for fabrication of perovskite solar cells at room temperature to preserve their structural integrity and to allow for large-scale production. And apart from that, it costs on the thermal budget. And in terms of the inclination angle, 45 degrees was observed to be the suitable deposition angle for the optimum optical transmittance and electrical conductivity. And when that was optimized in the first thin film, that is ITO, it is what was used for depositing the TTO films. Now, the TTO and the ITO thin films exhibited a very high optical transmittance of 95% and 90% respectively in the visible region. This is, I will say, this is very high compared to what has been reported in literature. And low sheet resistance of 62 and 419 ohm per square were obtained for the ITO and TTO thin films respectively. And the research was disseminated through publications, 3 journal articles and 1 book chapter, and there are 3 conference presentations. And I will want to acknowledge AAP and my mentors, Professor Chihua and Professor Matasio. I also want to acknowledge Professor Fan's research group at the Department of Electrical and Computer Engineering. And lastly, I thank you all for listening to my presentation. Thank you.
Thank you so much, Tabitha. All right, the final presenter in this group 2 is going to be Dr. Alice Ju, also from Egerton University in Kenya. So Alice, I will turn it to you.
Thank you, Justin. I'm trying to share. Okay, thank you. Okay, my name is Alice Njoe from Egerton University, and my work was detection of cisplatin with a boron doped electrode using flow injection, and also detecting it using the square wave. Now, cisplatin is a drug that is used to treat cancer. If you can look at its structure here, you can see it's a platinum drug having 2 chloride ions and then 2 amino groups. Is a drug that has been used to treat many various cancer tumors. And it's important for us to either monitor its treatment efficacy, to adjust its dosage accordingly when it's treating the tumor. If we have excess of this cisplatin, you can see it causes toxicity on the renal, the neuro, and the gastrointestinal. And again, this drug can also develop resistance. And we also need safety for the patient and also to check his quality control. Are we using the real cisplatin? So it's important for us to be able to detect it. Now, what was my research objective? My research objective was to investigate the electrochemical detection of cisplatin using the boron doped diamond, and also to determine whether the electrode can be able to oxidize this drug. Then we look at the analytical detections figures that merit either to make standards and also to check it on biological samples. My specific objectives were to see the behavior of cisplatin on this electrode. Then we optimize the different electrochemical conditions for its detection. Then we get a lineage of its concentration to know what's the minimum concentration to the highest concentration. Then to compare how cisplatin behaves in a BDD electrode, that's a boron doped electrode, and compare it with a common glassy carbon electrode, and also to evaluate its detection in both standard and biological solutions. Now, there are present methods that have been used for detecting cisplatin, because it's a drug that has been used for quite some time. And some of the methods that are used are chromatography, where they use the LCMS and also the HPLC, because cisplatin is UV active, and also spectroscopy, and also fluorimetry. These are methods that have been used for detecting. And if you look at these methods, like I'm having an instrument here for one of them, you can see they're either qualitative, they take a longer time to report, and they also require a specialized equipment like this one and specialized training for you to be able to use it. So we are looking for a method now that can be quite rapid, it's inexpensive, it's simple, sensitive, and a selective method of quantifying cisplatin. Now, how does cisplatin, once it gets into the body, how does it behave? So as I said, this was the structure of cisplatin. So when it gets into the body, you can see either it has one of its chloride ions replaced, or it can have the two chloride ions replaced by the water molecule or by the fluids in the water molecule. And how it binds in the DNA, in the cells of the DNA, you can see that the nitrogen atom, the platinum is able to form a bond with the nitrogen atom of the guanine in the DNA. And you can see that it can be able to bond either when they're next to each other, or away from each other, or in different strands of the DNA. So these are within the strands and in two different strands. And you can see the most effective is when it's next to each other. It's able to decrease what I'm saying, it inhibits the replication and the transcription of the RNA of the tumor cells. So when it has a higher percentage. But not all the cisplatin is able to bind with the nitrogen atom of the guanine. So some of it is blocked by other cells before it reaches the DNA, and it's able to go to the body fluid. So some of the excess now is the one that flows out, and that's why we are saying it's able to form toxicity. So it is important for us to be able to detect it even on the body fluids. Now, the widely common methods that are used for detecting analytes are many, but we are using carbon electrodes. And where we are working on carbon electrodes, it's because they are of low cost, they are chemical inert, so they will not react with my analytes, and they also have mechanical stability, and they have a very wide window of analysis. So this is the grassy carbon, that's the structure of the grassy carbon that I'm having, that I'll compare with. And then I'm also working with the boron doped diamond. This is the structure of the boron doped diamond with the carbon, and the red ones are the boron that have been doped into that diamond. And the growth occurs at very high temperatures under these conditions. And they're able to provide a low background, signal to background ratio. And they work very well at very high anodic polarization. Now, how does the electrochemical analysis occur now? We usually have a potential start, and this usually helps to supply a controlled voltage between the working electrode and the reference electrode. We usually work with 3 electrodes, all of them in one cell. You can see it's one cell. And electrons flow from the counter electrode to the working electrode and then to the reference electrode. Now, in the working electrode here, it's where we have the chemical reactions or the chemical reactions taking place around here. And here is where we can have either oxidation or reduction of the analytes that's already in there, that becomes our electrolyte. That's what we are having here. And when we have any of these reactions, you get like a peak. If you look at here, you can see this is current, that is the controlled potential, and you can get a kind of a peak. And we are saying the peak is proportional to the analyte concentration. So you get a peak depending on what concentration you are having. And in this membrane, we also have change of the ions. You have some, because you are starting from a less positive to a higher positive because you have either oxidation or reduction taking place. So that's how it works. And most of the reactions or electrochemical reactions usually take place at the working electrode. So this is the methodology I was using. Now, this is my working electrode, which is the boron doped diamond. And you can see it starts from the silicon base, then seeding of the diamond, then the boron being bonded to it. And you can see the bonding of the boron. And here is where we are saying that it's where the electrochemical reaction occurs. So we are having the platinum 2 going to platinum 4. And then how are we able to get? So we are able to analyze it, how we are able to get the reaction that has taken place, how we are able to get the electrochemical reaction is using a cyclic voltammetry or a square wave, which we are going to see. And then we also look at this material we are using. We characterize it, and we can characterize the material now using these 2 different kind of methods. So we start by characterization of the material. If you look at it, these are scanning electron microscopy. These are the 2 boron doped electrodes that are used. If you look at this one here, you can see that if you look, this is 1 micrometer. So the size of the crystals are bigger, while this one is the size of 1 micrometer. These ones are smaller, are within the range. So we give them now, we say that ones that are bigger, we say they are polycrystalline, and the ones that we call them nanocrystalline BDD. And both of them will now, because of the electrochemical reactions that are taking place on this electrode, they'll give us now different currents depending on the material. That's why it's very important for us to know what how our electrode looks like. So this is what one thing we did. Then the other one was Raman spectroscopy, because we are able to know, because we have a boron that has been doped on the diamond. So we are looking at peaks around 500, you can see 500, and this other one, 1200 centimeter. So it tells us how the distortion of the diamond has occurred. We also look at peaks around here to show whether we have impurities of sp2 hybridization, and those are very important for us to be able to characterize how heavily doped our electrode is. So that's what we used now to help us get to the different structures, the chemical characterization of our structure. Now, after that, we said that how do we know what kind of a reaction and how do we test it? And how do we know that we have any reaction taking place at the working electrode? And how we are able to know is using a cyclic voltammetry. And here I'm having cyclic voltammetry of cisplatin in both BDD, this is the boron doped electrode, and also the grassy electrode. And you can see the oxidation peak. So this is our oxidation peak, and this is the oxidation peak. And you can see this is more positive on the BDD. It's occurring at 1.25 volts. This one is less positive, so it is occurring at 1.15 volts. If you look at the peak current, this is the I peak current for the BDD, you can see it's occurring at, we have a higher peak current at 47 microamps, while this one is 30 microamps. And if you look at this, now becomes my background. This is the 0.1 molar, that's my background. And this is the linear sweep of the 1.1 molar cisplatin. You can see the background current. This one is a little bit lower, but you can see this one remains constant for quite some time, and you are able to be able to get a pink current, which you can be able to observe it clearer compared now to RGCE. I also did now the square wave voltammetry. Now here is where you analyze at different concentrations, and then now you are able to be able to detect the minimum concentration that you can be able to get. So this is in the BDD electrode, and this one also in the glassy carbon electrode. You can see the signal background ratio here remains almost constant in a BDD. This one increases as potential increases, it's changing. And if you look at it, you can see at 1.2 volts, because that is where we are getting our peak, you can see the minimum that can be detected here. If you look at this minimum, it's around 0.15 molar. The same here, because it's at 1.1, you can see the minimum, this one here, is around 0.144. And a linear ratio is drawn to be able to get now the current and the concentrations in millimolar. The same for this. And if you look at the linear ratio, you can see these ones are deviating from the linear ratios. So we can say that the minimum concentration from a linear ratio for both electrodes, we can talk about 100 micromolar. That's how the two electrodes can be able to detect. Now, I did potential sweeps, rate effect. So you are scanning at different scan rates. And this one we are checking on the limit of the semi-infinite linear diffusion of cisplatin to the electrode surface. And I did it and we read you can see this is a sweep all the way up to 1.5 volts. This is up to around almost the same value. And we got the reading at around 1.30 volts for the BDD and 1.2 volts because this one is less positive for a GCA. And you can see it's increasing linearly as the scan rates, as the potential sweep increases, you can see it is increasing linearly. And this was done, it was reproduced 3 times so that we can be able to get the variation between each electrode with 3 different electrodes. This was the same, we've done it 3 times, and so that we can be able to get the difference between the two. Now, the other thing that I did is an experiment of a flow injection where I wanted to get the minimum detection of cisplatin using this method. So in a flow injection, what we have is a carrier solution that passes through a pump, and then the solution comes and mixes with my injections of cisplatin. And then now it passes through the electrode. The electrode is connected to a potentiometer, to a potentiostat, and now a reading is obtained and you can be able to get it in the computer. So our flow rate from the pump, from this pump, is 1 ml per minute. That was the flow rate of my carrier solution, which was 0.01 molar perchloric acid. Now, the volume injected of cisplatin, because I was injecting now the different volumes of cisplatin of different concentrations. So the volume injected, it's supposed to be 25. In case you inject excess, it goes to a waste. That's why we are having a waste here. Any more than 25, it becomes a waste, so it goes to a waste. So this is loaded plus my carrier solution into my sample, and I'm able to get a current time kind of a curve, which you are seeing it here. And now this gives me my sample current. This is the sample current, while this remains the background. And you now get what we are calling this is a current time curve. So this is the IT curve. So I did that at different potentials and also at different concentrations so that I could be able to get the minimum cisplatin that can be detected. Now, this is the hydrodynamic of the FRE mode. And this is my background, how it remains at each potential. So I did at all from 0.9 to 1.3. That's how the background remains. And how does the 1 millimolar I was injecting 5 times. And each injection you inject 5 times after 1 minute. And then now you're able to get the current. And now how does it behave with increase with potential? And you can see it increases. And why we are doing this is because we want to get which is the maximum potential that we can be able to analyze our analyte. And that's why you are getting this kind of a graph. We call it the sample background ratio, which we get this, the sample background ratio. You can see that how you are able to obtain it. And we were able to get the optimum potential was 1.2 volts. So from here, we now analyze our analytes at this a maximum potential, because we can be able to know that the maximum is this, and then we're able to analyze our sample. So we analyzed our cisplatin of different concentrations, where we are having 5 injections each, from 0.5 to 250 micromolar. So you are injecting 5 times of each concentration, as I had explained earlier, and the carrier is perchloric acid. And you can see with this graph, we could be able to detect a concentration of 0.5 micromolar, compared now to the square wave, where we were getting a concentration of 0.1 or 100 micromolar. So this can go to very low levels, and that's now how we were able to detect. And if you look at the graph here, you can see at higher concentrations, the linear deviates from that. So it's able to detect at very low concentrations. So the lowest concentration that we were able to detect with the flow injection was 0.5 micromolar. So in our conclusion, we can say that the minimum cisplatin that you can detect in the BDD was 100, and for in the flow injection was 0.5, and this is the linear edge that we are working with, and that's now we can say that the BDD electrode, we can be able to say that it can be able to oxidize the cisplatin drug from platinum to platinum 4. And I would like to acknowledge the AAP, because they gave me a chance to come and do research. My mentor, Professor Swain, who has mentored me in electrochemistry. It was a new area for me. And also my research group, especially Jacob Arons, who has been with me all through as I've been working. My mentor from Kenya, Professor J.O. Molo, and the Egerton University University community for their support. And thank you all.
Thank you so much, Alice. All right, we will move right into the Q&A for the Science, Technology, and Innovation group. So I will hand it over to Tony.
Thank you, Justin, and thank you, presenters. Very quickly, we have our first question. So this one goes to Dr. Niang. This one coming from Lala Konta. She says, how can the predictability of MJOs enhance the mitigation of extreme events such as floods? And how can it be useful for the establishment of early warning systems? So very quickly, Dr. Niang.
Okay, thank you for the question. So I have to mention that the West African region is characterized by a very complex monsoon system, and in the state of our climate, it remains very challenging for the existing model to predict weather pattern over this region. So as you know, the MGO, they tend to modulate the tropical convection and precipitation. And by identifying the active phases of MGO, so the scientists can predict the period of increased rainfall, aiding in flood forecasting and disaster preparedness. So it is mainly based, this improve of weather forecasting is mainly based on 2 factors, which are the extended lead time that the MGO have, and also its enhanced accuracy. So by the extended lead time, I mean that the MGO influence weather pattern on the time scale of weeks to months. So by predicting the MGO phases, so they can provide an extended lead times for potential flooding, so that the authority can better plan and prepare for potential flooding and reducing the risk that are associated to that. And now for the enhanced accuracy, we know that the MGO, we have an accurate MGO forecast. In the state-of-the-art climate, the MGO could be predicted 2 to 3 weeks in advance, mainly over the Indian Ocean and West Central Pacific. So what we are trying to show is that since we have very weak skills This model have a very weak skills over West Africa. And regarding the MGO, so it could be predicted over the Indian Ocean in the Western Pacific 2 or 3 weeks with a very good skills. So we can use what has been found as the contrast that exists between the Indian Ocean and West Africa. So we can use that contrast. So as a potential predictor, since the studies have found that there is a time lag of about 15 to 20 days between these two regions in terms of anomalous convection. So I mean, okay, by that I mean that the MGO activity over the one pole, the Indian Ocean, so they show that locally reduced convection that are associated with latent heating anomalies over that pole, they tend to force dry equatorial waves, Rossbys, that can reach approximately 20 days West Africa. So that means that if we have, for example, some positive anomalies convection over the Indian Ocean, we might have 20 days later the reverse configuration of West Africa. So the main objective of using this MGO is just to use that potential contrast between those poles to predict the anomalous rainfall over West Africa, since we have a very big challenge with the latest generation of the existing model to predict the pattern over West Africa. So I don't know if I give a good answer for your question. And regarding also the early warming system, so since we see that the MGO have a significant impact on atmospheric and oceanic condition over the globe, so by understanding the mechanism of the MGO, so it can help improve the accuracy and lead times of weather and climate prediction. Thank you.
Yeah, you definitely did answer that question, Dr. Nyan.
Thank you.
Dr. Njue and Dr. You are off the hook. There are no questions for you. So
okay, thank you.
And I'll ask Justin so we can move on with this next slide of presentation. Thank you.
I would ask though, you're not totally off the hook. If any questions do pop up in the chat or in the Q&A,
Okay.
please feel free to answer those via text. So
Okay.
thank you, Tony, and thank you all. Moving on to our final group, Agri-Food Systems, Youth Empowerment, and Education. First up, we have Dr. Florence Nakamanya from Makerere University in Uganda. So Florence, over to you.
Justin,
Yes.
I can't share.
Give it a shot. You should. There we go.
I'm sharing.
Great.
Good morning and good afternoon. I'm Florence Nakamanya, a lecturer in the School of Higher Education at Makerere University in Uganda. This slide will guide our presentation. I have been mentored by Professor Brendan Cantwell and Professor Ronald Bisaso, and our presentation today focuses on women senior academics. Academics is constructions of professional success in universities in Uganda. And this is part of the broader project on women in leadership in higher education. Dear friends, there is a paucity of women senior academics globally, and Uganda is not an exception. The proportion of women senior academics varies by country, by region, and discipline. Interestingly, women senior academics contribute to institutional knowledge, to institutional wisdom, leadership, and mentorship. And in the Ugandan context, universities have developed policies to hire and promote women academics, but these have not resulted into noticeable career advances. And this is simply because of the structural barriers, gender biases, and discrimination. Available evidence shows that 14% of the full professors and 20% of the associate professors are women in Uganda's premier university. And when it comes to the College of Education and External Studies at Makerere University, there is one female full professor and one female associate professor. And there is a similar or even worse situation in the public and private universities in Uganda, most especially in the STEM fields. And yet, gender equity is not only a social goal, but it's part of the Sustainable Development Goals, and in particular, Goal 5 and 10. It's part of the African Agenda 2063, particularly Goal 17. It's part of our Uganda's Vision 2040. And interestingly, it's part of the different strategic plans in the different universities in Uganda. So looking at that, our research questions, therefore, are going to bridge this problem with the theory of the case. We wanted to find out how women academics define professional success, to what they attribute their professional advancement, and what their capacity needs are in Ugandan universities. In this particular presentation, when I talk about women senior academics, I'm basically talking about the women at the peak of academia. And these are the full professors and the associate professors. And in this study, we purposely selected and interviewed 12 women professors from different disciplines and different universities in Uganda. The disciplines were categorized according to Beach and Bigland's typology of academic disciplines. And when it came to the universities, we got our data from universities, different universities that are state-owned, those that are formed on the basis of the different religious denominations, and then those that exist for profit. Our findings reveal that women professors in Ugandan universities define professional success in terms of objective construct and subjective construct. And from the data, it was predominant that the female professors attributed their success to teaching excellence, and this encompassed issues like developing graduate programs, reviewing the curricula, and this was very prominent, especially in the soft applied disciplines. That's like education and business. And when it went to the issue of research recognition, these women professors, especially in the hard applied disciplines, also shared that their success was simply as a result of the number of publications they had, publishing in high-profile journals, securing research grants, among others, and then also attaining positions such as departmental chairs, deans, being committee members was a sign of success to our female professors. An example on teaching excellency, a professor from education shared that she was not only successful because of teaching and students passing and graduating, but she felt that developing different graduate programs was key for her. When it came to subjective construct of our female professors in Uganda, the issue of mentorship cut across all the disciplines as they saw mentorship of early career researchers and their graduate students as a sign of success. They were also equally successful or felt successful when they participated and impacted the communities in which they lived in. And also the issue of work-life balance was a sign of success. And just one professor from a soft pure discipline shared that mainstreaming gender in teaching and research was a sign of her success. A quotation on mentorship, this was basically a professor showing that she would feel happy to leave the university after she has reproduced more of herself. Our findings also revealed that women professors attributed their success to personal attributes and also external support mechanisms. And here the issues of hard work, dedication, resilience and adaptability was key. There was no shortcut for any academic to progress to position of professor unless those were in hand. And also when it came to the external support mechanisms, they attributed their professional advancement to the academic achievements that they had gotten in the process of serving their universities. And this came in line with the issues of the publications they had, the grants they secured. That was a success for them. But also they never forgot the issue and the role played by their professional and social mentors, and as well as the internal and the informal and formal mentors. And so when we look at the quotation on academic achievement, a professor in a hard applied discipline in a public university shared that the human resource manual of her university was part and parcel of her life. It was more like a Bible to a Christian, and it was more like a Quran to a Muslim. This is where she got to know what was required of her before she climbed to that position. And so that becomes key for us to know what is required at the level at which I want to be. Then when it comes to the issue of networking, there were joys all over the data set that networking played a lot of role, especially when they networked with the different national, regional, and even international, in their international networks. So all these helped them to secure grants, helped them to publish, helped them to do different activities in line with teaching, research, and community engagement. And so that said, all these kinds of achievements therefore enabled them to advance to position up to the level of professor. Our findings also reveal that our women professors in Ugandan universities want to be supported in terms of how they can access funds, and this basically when it comes to the international funds. And the resources was also key to those, especially in the science subjects, where they alluded to the fact that there was no space for them to perform some of their experiments in our local laboratories. Then also the women professors want to be capacitated in terms of trainings, and they're saying they have particular needs they want to be trained in. And these include issues of writing grants. And this was very key, especially when it came to those at full professor. Then when it comes to publishing, especially our associate professor wanted to be supported in that, because they shared that actually they needed a lot of publications to be in position to climb from associate professor to full professor. And lastly, our women professors also want to be capacitated, especially in how to balance. There are so many professional roles and alongside their personal roles. And this was very important because they shared that as professors, they were supposed to do teaching. And what was alarming in the data, you'd find that some of our professors actually teach over 18 hours a week. And so they claimed that there was no time for them to perform certain aspects of research. And so they want to be capacitated in how they can balance their professional roles and their personal roles. And when it came to the access of funds, there is a professor from a soft applied discipline in a private university who shared that, yes, she has won projects, but she would want to win or to be facilitated to win international projects, just like his male counterparts, especially in the science fields. And lastly, on professional development, yes, they wanted to be capacitated that how best can they get international collaborators, because they felt they were doing well in the Ugandan context, but they wanted to see how best can they get these international collaborators, and at the same time, how best can they sustain these collaborations. As a result, we therefore conclude that women professors define professional success in universities in Uganda holistically balancing personal excellence and societal contributions. We also conclude that professional advancement of women professors is attributed to a a complex of personal attributes and external support mechanisms. And lastly, women professors and universities in Uganda seek support in how to access funds, resources, professional development, and how to balance their professional roles and personal roles. With that, we therefore recommend to prioritize comprehensive support system as a way to address this, as a way to address the women professors' constructions of professional success. And we also recommend to offer targeted professional development programs, because after this study, we now know as institutions of higher education what the professors in Uganda would need. And therefore, as we design these leadership trainings for them, let's try our best to capture their needs. And the needs we said are access to funds, resources, professional development, especially in how to win grants, how to publish, and how to balance their roles. And lastly, we also recommend to advocate, we also advocate for policy changes and institutional reforms. And that way, these will address the systemic barriers in academia, but also promote the global and national aspirations as reflected in the different SDGs in the African Agenda 2063, and obviously Uganda's Vision 2040. That is my contact. And at this point, I want to share with you that this project has been made possible because of the funding from the Alliance for African Partnerships. Thank you so very much for transforming my life. I want to thank my mentors, Professor Brendan Cantwell from MSU and Professor Ronald Bisaso from Makerere. A wonderful job you have done. And I trust I cannot go back. Then last, I also want to thank the entire team of Michigan State University. It has been a wonderful stay here. The College of Education, I'm so indebted. Thank you very much. The Center for Higher and Adult Education, wonderful professors in there. I want to thank Makerere University, my Vice Chancellor, Sir Professor Barnabas Nawange. Thank you so much for granting me leave. I want to thank the College of Education, my colleagues in the School of Higher Education, dear students in our school, my participants for the study, the professors, the early career researchers. Thank you so very much. And I want to thank the audience. And lastly, ladies and gentlemen, I want to thank my family for being so supportive. My mom, I'm missing you already. Thank you so much, Joe and everybody. And with those remarks, I pledge to build for the future, for God and my country. Thank you.
Thank you, Florence. That was a very insightful presentation. All right, we need to move along here. So next up on our list is Dr. Rejoice Tobias Mamina from the University of Pretoria in South Africa. Rejoice, it is all you.
Hi, Justin. Can you allow me to share my screen?
Yep, you should have access.
Good morning, everyone. Please allow me to introduce myself. I'm Rejoice Tobias Mamina from the University of Pretoria in South Africa. And at MSU, I'm affiliated to the Department of Agriculture, Food and Natural Resources, Resource Economics. And the topic of my project is the effects of naming convention and information on consumer preferences for farm-raised meat and meat alternatives. Right. In terms of the background of the study, looking at extant literature, there is increasing widespread adoption of alternative meat proteins, and it is a challenge given the lack of information and research available on consumer preferences and demand for these products in South Africa. Therefore, this project presents an assessment of consumer acceptance and demand for alternative meat proteins. Secondly, the effect of naming convention of beef alternatives on consumer preferences. And thirdly, the effect of information provision on demand for farm-raised meat compared to insect-based meat, plant-based meat, cultured meat alternatives. Is an increase in global meat consumption. When you look at South Africa is actually rated 9th highest globally per capita beef consumption and 11th highest poultry consumption. South Africa consumes over 17 kgs of beef per capita, which actually increased from 2003 to 2016 at a rate of 54%. And it is also projected to have an additional 23% between 2016 to 2028. So increased meat consumption is actually due to the increase in human population, increase in income, and also urbanization. This increase in meat demand has some implications. The implications are actually centered on the burden on the food system, which is already under pressure due to food insecurity, and also the increase in environmental and human health concerns. When we look at the environmental impact of livestock production, right? Globally, livestock production accounts for approximately 14.5% of the global greenhouse gas emissions. And also the consumption of red and processed meat is associated with negative health outcomes, which include obesity, cardiovascular disease, and diabetes. For example, in South Africa, the adult population obesity prevalence sits at 28%, which actually brings us to the question, would consumers consider a food diet with less animal protein to mitigate the environmental and social impact or health impact? I'll start off by defining the variables of the research. When we talk of the insect-based meat alternatives, these are meat substitutes made from insect species designed to look like, taste like, and cook like farm-raised meat. Plant-based meat alternatives, these are commercially available food products derived from plants that are designed to mimic the preparation methods and sensory qualities and nutritional profile of meat equivalents. And finally, the cultured meat. Some will prefer to call it cultured meat. In this project, we call it cultured meat. Others call it cultivated meat, and others call it lab-grown meat. This is real animal meat produced under lab conditions by introducing muscle biopsies from donor bovine animals to a culture medium where they multiply under controlled conditions and develop into muscle fiber. There actually has been substantial startup capital in South Africa in investing in the development of the cultured meat. For example, the Mzansi Meat company. So, because of this widespread adoption of alternative meat proteins being a challenge, and also there is a lack of information and research available on consumer preferences and demand of these products in South Africa, this project presents the three objectives which feed into the three hypotheses. So in terms of the hypothesis, we have hypothesis 1, South African consumers will prefer farm-raised meat the most, but will show a high degree of acceptance for the alternative meat products. And then we posited now hypothesis number 2, restricted meat-related labeling will affect consumer preference for farm-raised meat relative to meat alternatives. This is because this restriction is coming from the debate that is currently in South Africa, where the meat industrialists are actually fighting for the restriction of any meaty words like sausage, meat, beef, burger. Then hypothesis number 3, the marketing and policy efforts that connect consumer preferences to the product's health benefits will have a higher or a greater impact on increasing demand for alternative proteins than those highlighting environmental benefits. So in terms of the methodology that tested the hypothesis, this research used the experimental design. So in terms of the experimental design, the consumer preferences were actually elicited using the discrete choice experiment, which is actually extensively used in demand analysis. So in this discrete choice experiment, the simulated shopping scenarios in the choice experiment consisted of the 4 product alternatives, which is the farm-raised beef, the cultured beef, the insect-based meat alternative, and the plant-based meat alternative. And on the simulated experiment, there is also an option for a no purchase option. And all these 4 are actually provided in different price levels, that is 4 price levels ranging from 40 rands per 450 grams to 190 rands per 450 grams in 50 rand increments. This actually reflects the retailing price for each of the meat alternative. So I will present an example of this experiment on the next slide. So this is just an example of the experiment with the addition of a no option. So the participants had actually an option to choose none of the options presented. So the study uses also a between subject approach to examine the effects of information on consumer preferences with 4 treatments. So in terms of the information, the study looked at the environmental benefit, the restricted naming, environmental benefit, and the health benefit. So the control group received no additional information beyond a description of the product alternative. Then we have treatment 1, which actually had the discrete choice experiment questions plus the restricted naming. And treatment number 2, the discrete choice experiment questions plus environmental benefit. So in terms of the environmental benefit, what was presented was the decrease in greenhouse gas emissions when producing alternative products, alternative meat products in comparison to farm-raised meat. So looking at the greenhouse gas emission decrease, the decrease in water usage, as well as the land use. Then the treatment number 3 also used the discrete choice experiment questions plus the health benefits, looking at maybe the iron and the sodium in the meat. Now, in terms of the results show that there is no significant difference across groups when looking at each demographic characteristic. And each demographic characteristic, we actually used the Stats South Africa classification, especially on gender and ethnicity. Now, based on the output from the control group, looking at the key results, if you check on the control group, you can actually see that people have a high demand or willing to pay for farm-raised beef relative to other alternatives, which is not very surprising on the control, where we have 195.94 rands per 450 gram. And also, based on the same control group, you can also see that people don't generally like insect-based alternative burgers or alternative meat because of the negative 32 rand. And then there is also a moderate demand for both plant-based alternative and cultured meat burgers in the control group. You can see the plant from the table, the plant-based at 76.99 and the cultured at 83.04. Now, the study highlights the following. If we go back to our table on the key results, on the naming, the environmental, and the health benefits. So, three highlights can actually be extracted from the results. Number one, in terms of the environmental benefit. So information on environmental benefit increases the willingness to pay across all alternatives. This indicates that many consumers are willing to pay a premium for products that contribute to environmental well-being. Then the second highlight is on the health information. Looking at the results from our previous table, health information only increased the demand for plant-based, while it actually decreases the willingness to pay for insect-based alternatives, which is also very, very interesting. So we can actually interpret it as maybe the consumers might have a strong biases and aversions towards insect-based alternative products. Therefore, health information alone may not be sufficient to overcome these perceptions and can even reinforce negative attitudes, leading to lower willingness to pay. Then our third key finding is on the restricting of the words, the meaty words like burger and beef. So restricting the meat words such as burger and beef does not affect the demand for farm-raised meat. Instead, it may increase the number of consumers in the plant-based alternative and cultured meat market rather than reducing the demand for farm-raised meat. This actually is contrary to the claims by the meat industrialists that there is a substitution when alternatives are also using the words normally attributed to meat that is harvested from animals. So these research findings actually provide us with three distinct implications. The first implication is on the marketing strategy, and also on the policy considerations as well as consumer education. So in terms of marketing strategies, it is best to implement marketing strategies that develop or that address consumer biases and aversions, as well as those that leverage the distinct identity of alternative proteins to appeal to consumers interested in sustainability and innovation. And in terms of the policy considerations, regulations might need to balance clarity in labeling with supporting the emerging market for alternative proteins, ensuring consumer understanding without hindering market growth. And lastly, implementing consumer education. So clear and informative labeling, even with restrictions, can help consumers make informed choices, potentially increasing the overall demand for alternative products. So these findings actually provide stakeholders an understanding of how best to navigate the evolving landscape of the food industry, leveraging the growing interest in alternative proteins, optimizing marketing efforts, and support the sustainable growth of the alternative protein market globally while maintaining clarity, transparency, and in product labeling. Right, given the diverse preferences for the meat alternatives and the rapid growth of the innovation, further research could explore economic viability and market potential of alternative protein in various African regions, and also conduct comparative studies in different cultural contexts to explore the global applicability of various labeling strategies. So before I conclude, I would like to take a moment to acknowledge those who have contributed to this project. Firstly, I would like to thank the AAP, MSU for providing the resources and funding necessary for this research. A special thank you to my two mentors, Professor David Ortega and Professor Yolanda Jordan for their guidance and support throughout this process. I would also like to extend my gratitude to Lin, whose dedication and hard work significantly contributed to the success of this project. Finally, I would like to say thank you to Florence Nekamanya for being an excellent housemate. And once again, thank you to everyone who contributed. Your support and collaboration has been greatly appreciated. Thank you.
Thank you so much, Rejoice. All right, moving to our final presentation. We have Dr. Catherine Fulgence from the University of Dar es Salaam in Tanzania. She is last, but certainly not least. So Catherine, I turn it over to you.
Okay, thank you. Allow me to share my screen. I hope you can see me. All right. Okay. Just a minute. Okay. All right, so as you can see in the title, I'm focusing on enhancing the state of undergraduate employability at the Tanzanian higher education institution, and in particular the University of Dar es Salaam. So on the background, yes. So on the background, research on employability of undergraduates has been trending, and it's one of the key area. And why employability is important, because it enables for all forms of employment. When I say all forms of employment, I mean formal employment, independent self-employment, and employability has to do with skills and competencies and knowledge and how one utilize everything to ensure that they are competitively engaging in the world of work. Regarding, whether research has been done, still there has been a continuous gap on skills among graduates. And enhancing employability has to do with the academic programs, and normally it is done from the lower levels, but highly in higher education institutions. And this is done through academic programs, through participation in entrepreneurship education courses, and also participation in skills development programs. And sometimes also industrial collaborations matter when it comes to enhancing employability of our students and even the graduates. Now, when we look at research, we are learning that there exist different mechanisms of enhancing employability. And also, there are also disciplinary mechanisms. Research also shows variations among disciplines when it comes to enhancing employability. Of course, the research is general, but now specific research focusing on disciplinary variations is limited, and this is where is the focus of my study. So this study along the themes of AAP, focusing in mapping the skills development program activities at the Tanzanian higher education institution, and also I intend to find out how students engage, especially in skills development programs. And of course, I will also establish the state of art regarding the provision of entrepreneurship education. So in other words, I'm exploring all the mechanisms. I'm mapping the existing mechanisms of enhancing employability at higher education institutions, including the challenges and prospects. Now, when it comes to the theoretical background, yes. So theoretically, we understand that investment in education and training enable for one's enhancement of employability, and this is human capital theory. But also we are understanding that individuals construct individual career path. This is career construction theory. But on the other hand, we do have structured programs. These are extracurricular, not the core curriculum. So these structured mechanisms enable for individuals, even students, to enhance their employability. And these ones are within the university structures. And also we have theories like entrepreneurship theory. We are of the view that these skills can be imparted through entrepreneurship education, and also entrepreneurship, besides developing entrepreneurial skills, it enables one to see mechanisms for creating self-employment. Now, on the methodology, This study used mixed research method, and also I had to carry out some documentary review. Okay, I also had to carry some documentary review. Sorry, a little bit, I have a technical problem, just a minute. Sorry for that, okay. So this study used mixed research method and documentary review, and used the qualitative and the quantitative data. And maybe you see the table below, you can see the demographics of the students that are engaged. They are 712, and you can see the gender, you can see the studying of entrepreneurship education. You can see only 24.3% are engaging in studying entrepreneurship education. And when it comes to engagement in skills development program activities, you're finding they're saying yes, 82%, but now I'll qualify, what does this mean? And when it comes to work experience, because we use the final year students, most of them, they do not have any work experience, but you should take note as well about their plans after graduation. Most of them, you could see they want to employ themselves. And this is because there are limited job opportunities. And the 28 would want to secure formal employment, and the others would want to pursue further studies. And when it comes to the qualitative part, so here I interviewed the management of higher education institutions, trying to see what are the mechanisms for enhancing employability. And these are the key people that I interviewed. They were 40, the qualitative study participants. So I used the mathematical analysis and the SPSS for that matter. Now on the findings, these are the mechanisms, institutional mechanisms meant to enhance employability. You can see degree programs and courses, and I'll qualify some of these. And also the university offers structured skills development programs, and this enables students to participate, and also have university directorates and structures, and also training practicum. So you can see, by and large, the university is of the view that employability is enhanced through the degree program and courses, and less likely, of course, you can see the percentages along the mechanisms. Now, let me briefly talk about the causes under the first mechanism. So if you read from the left side of my presentation, you can see the findings are showing, of course, I generalized the mechanisms, but when you come to specifics, you learn that there exist disciplinary variations towards enhancing employability. For example, in the natural sciences, you can see, besides the academic works or the academic courses, we have lab work and new products are produced. Now you can see on the right side, these among the products that are produced by students in collaboration with faculty members. You can see the honey, you can see the wine, you can see some of these packaged fortified flour. So these are among the things that are happening in the natural sciences. That is on one side. But when it comes to vocational arts, normally they have training practicum. When I say vocational arts, I mean students like from the business school, from education, and so forth. Even the engineering are vocational, but in the natural sciences. And then when it comes to non-vocational arts, we can notice that they do not have, most of them do not have the training practicum, so to say. So for them, employability is enhanced through non-vocational arts. But also, I also explored, because I mapped the mechanisms along the academic programs, the provision of entrepreneurship education courses, and even the skills development programs. Now, when it comes to entrepreneurship education courses, you can see the whole university is having 18 entrepreneurship education courses that they are studied by students. And these courses are offered in 6 out of 18 units. When I say units, I mean the academic units, like for example, a College of Law, or for example, Natural Sciences, the College of Natural Sciences or College of Engineering. So only 6 out of 18 of these units are offering entrepreneurship education courses. But there's only one course along the university where all students are supposed to study. But this course is development studies. This course only has a module of entrepreneurship. All right. And then the remaining units now integrate entrepreneurship along the academic programs. So in other words, 2/3 of the university units or the colleges, like you can see, they teach entrepreneurship impliedly. I mean, it's not that
mandatory. So you can see from the table, as you can see there, so there are some mandatory courses that are program specific, okay, for non-business students. And some of these courses are mandatory, but are unit specific. When I say program specific, it's like, for example, you can find the College of Engineering is having 5 degree programs. So you find only 1 degree program is studying a course, something like that. When we say unit specific, it means within a bachelor degree program now, only some few students are studying the course. So this is the state of art, but overall, if you come into an interpretation, we can learn that most of the courses, as you can see, they are program specific or unit specific. For the third aspect, these are mandatory or elective. You can learn that the course is mandatory in a certain, for example, let's say for all, say the bachelor, I mean the University of Dar es Salaam Business School, but now there are some other students from other units that are opting it as an elective. And the other courses, for example, the MK, and these are elective courses for all units, but now they are not mandatory in other words. So in a nutshell, this is a state of art regarding the provision of entrepreneurship education. So we have a combination of business, non-business units that are offering these programs. So we can say that when it comes to SDP, skills development programs, of course, there is also diversity across the provision of the programs in terms of modality, mechanisms, the membership, management support and everything. But when we come to the engagement now, you can find, let me focus on the mean. You can say students now in a 1 or 2, if yes or no, you can say 1. So that means the participation is not that good. So on average, they engage in 3 skills development activities, and also on the frequency is 2.5. And this is not that consistently, indicating that they don't consistently engage, and even the variation is significant. And when it comes to the time spent, so they spend almost 4 hours, and you can see the standard deviation is 7, meaning that the variation differs. There is a high variation on the time they spent on the skills development activities. And you can see on the quotation as well, is that I say there is a diversity across disciplines, across programs and everything. So some universities, for example, some colleges, units, they even have a timetable indicating the participation of students in these skills development programs, having 2 hours dedicated per day. But in other units, that is not happening. So there is diversity, as I said. But what also came out differently is that there is a gap between the nature of the activities students engage in and the nature of activities they would want to engage in. I've reflected the top 5. So I said, they say 82% engage in skills development activities, but you can see of the 82, 42 engage in seminars, in student seminars. Sometimes they can be a seminar also. So you can see the engagement is largely on the seminars. Of course, you can see there are some other career development programs, workshops, and so forth, some of which are discipline specific. So these are on the left side, this is what is in place. But they would want to engage in these aspects on the right, the right side, the top 5. Workshops on entrepreneurship, innovation, business skills, vocational education courses, employability courses, seminars, something like that, even digital fluency and computer skills and things of the like. So these are among the areas that they would want to engage in versus the ones that are there. Of course, there will be challenges and also some opening recommendations. So on the challenges, we have institutional challenges here. We can see that the institution could at least ensure that at least there is a coordination of what is happening. So there is limited coordination. And also there exist challenges related to students' participation in skills development programs. Their understanding is that they do not contribute to their grades. And of course, they are of less value, so they do not participate. And when it comes to provision of entrepreneurship education, you could see we have elective courses and also we have mandatory, but it's only one module. One course integrates entrepreneurship as a module. So there is a gap in the provision of entrepreneurship education and even in participation of students in relation to enhancing their employability. And now, again, on the right side, on the prospects, there has been a curriculum review, and this has been ongoing, and most of the findings are recommending the integration of entrepreneurship,
in education, but not much regarding skills development programs, and also collaboration in networks, and also awareness creation about the skills development programs now that they are relevant to enhance employability. And these are among the recommendations that you can see to strengthen entrepreneurship education initiatives, even the skills development program initiatives, and the management support in terms of funding. For example, most of these skills development programs are not supported, and they are led by matrons or patrons, and these are the ones with the final say. And it was also established that the patrons or matrons who are leading these associations or the skills development programs, if they are leaders, then they are having more ownership and they can even solicit funding. But those who are not holding administrative positions, you find their associations, the students, they are looking for funding, while others, the ones who are having leadership positions, are supporting students, and they can organize very big events. So there is a lot of diversity in that direction. So the support from the management should be in this sort. And also, of course, we also need to strengthen the industrial revolution and industrial linkages, and also reviewing the curriculum. And sometimes the faculty also sometimes are not much engaging in skills development programs. So these are among the issues that were offered as recommendations. So when it comes to contribution to theory, we are learning that disciplinary norms and structure within our education institutions influence employability and even entrepreneurial outcomes among our students and graduates. So it is important to have disciplinary specific skills and experiences because they shape our students' career paths. And when it comes to contribution to practice, we find the relevance of designing discipline-specific employability initiatives, and also to monitor the implementation of the skills development program activities at institutional level. So for further research, I think we need to come up with research that is focusing on how to integrate the effective integration of policy and practice to enhance discipline-specific employability, and if possible, sector-specific employability challenges and opportunities. We have to conduct research in this area. And sometimes, for example, I've indicated some of the products that are produced in the College of Science, the products. We are finding that once they produce them, there is no mechanism to ensure that they are carrying on the business or whatever the products that have been produced. So we need to have mechanisms that will support creation of employment opportunities for youth through whatever that they are doing, even for others that are coming up with new innovations. And also, we cannot ignore the impact of digitalization, digital transformation on employability, and now that it also informs the development of future skills. So on the appreciation, I have to thank very much, as my colleagues have mentioned, the MSU AP for coming up with this program. It has been of added value to us in a very special way, and we're very thankful. And also, I have to appreciate the contribution of my university. They gave me time here. I'm here for this session. Let me also thank my mentors, Professor Owinski and also Professor Goodluck Urasa, and also my colleagues, cohorts. We also had learned a lot from the former cohorts. And lastly, my thankful to go to friends and family members for moral support. And maybe I should end here. Thank you so much.
Thank you very much, Catherine. All right. Well, I will turn it over to Dr. Tony Milanzi for our last Q&A session for Agri-Food Systems, Youth Empowerment and Education, and then we will wrap up with some closing remarks from Dr. Jose Jackson-Malete. Tony?
Right. Yeah. No, again, thank you all for these wonderful presentations. So to dive right into the questions, we have two questions for correct. Two questions for Dr. Florence. Yes. So the first one coming from John Bosco. He says, what was your criteria for classifying or grouping the responses to the question on professional success into objective and subjective forms? I'm aware that mentorship, community engagement, work-life balance, diversity and inclusion, which you labeled as subjective, have standardized measures that can be used to objectively measure them. Although they have subjective aspects, do you have any major reason for viewing these issues as subjective? And the second one for you is, why is it important for funders to support the career advancement for women researchers? at African higher education institutions. What two key arguments would you make to a wealthy male African who wants to support it, but is not fully convinced that this is a priority for his foundation? So those two questions for you, Dr. Florence.
Thank you so much. To the first question, which is JB, what I would say on this is that looking at this study being an exploratory kind of study in a context where professors are very few, and also borrowing from the literature of Thunderman, we realize that these women professors, their career, their constructions of professional success provided a diverse kind of explanations. And so basing on their career advances, career paths and disciplines, this kind of thing led to this dichotomy of how we constructed that. And then why should women research be funded? Okay, thank you so much. One, first getting it from the SDGs, goal 5 and 10, looking at the African agenda, it's part of the game. And so in order to transform these higher education institutions, women cannot be left behind. But also most importantly, you realize, take an example in the Ugandan context, women constitute the majority in the country, and you'll find many of them are actually trying their best to get into academia. And so if they're left behind, I want to believe that our institutions, actually, there is a lot they're missing, and you discover that perhaps some of the challenges that our institutions are facing, it's because of that patriarchal kind of existence in the institutions. And so when the women are part of this leadership, are part of the academia, are part of the research, there is an angle that they bring that spices up the business of higher education. Thank you.
Yes, so you still have a task of convincing a wealthy male African. They have a foundation and this is something they could, but they are still not convinced. How do you convince them? What two arguments could you give?
It's the one I've just answered.
Mm-hmm. Okay, so it's imperative because of these SDGs
and the way the higher education institutions are patriarchal situated.
Mm-hmm. Okay.
Yeah. And so bringing women on board, or getting more women funded into these spaces, it will bring a balanced kind of higher education, a balanced kind of approach to the business in higher education.
Right. Great. No, thank you so much, Dr. Florence. Colleagues, I think we should, unfortunately, we'll have to stop here. I'm sure we would have loved to interact with our panelists more, but we've been here for a while. So let me hand it over to Dr. Jose Jackson Malete to close this session.
Thank you. Thank you so much, Tony and Justin and our African Future Scholars. It has been a fantastic morning here for us in East Lansing. And whatever the times are, wherever you are on the African continent and maybe perhaps around the world, thank you for joining our program today and for listening to our scholars for the work that they have done over the past year and that they will be continuing to work on as they return home. So this is one of our flagship programs, as Professor Makandawiri mentioned earlier, addressing the issue of underrepresentation of women in higher education in African institutions is a key important program for us at the Alliance for African Partnership. Each year that we have these scholars here with us, we are so impressed with the work that they do, the work that they're able to achieve over a year. And we are looking forward to hearing the success stories from this cohort again. So the goal of our program is pretty simple, and it is addressing, and Florence, you actually have, kind of answered everything that we are doing here. It is to strengthen the research capacity of Africa's early career women researchers. They are underrepresented, underfunded, and do not have the kind of support that is needed for them to advance in their careers. And we have to do something about this. So Florence, I need you to find the answer for that wealthy foundation, that wealthy high net worth individual who we need to understand why this is important for funding. So we like to think that we are planting seeds across our consortium, across our 10 African universities, that we hope will eventually lead to real impact on the ground. We know that bringing 10 scholars here each year is just a drop in the bucket. It's really not going to do what we need to really make a big difference. But what we are hoping is that you have learned over the past year of how to better mentor your own students who are going to be the next generation of researchers on the continent, and that this will lead to a multiplier effect. So we don't expect that you have learned over the past year what you want, what you don't want, and that it ends here, but that you are going to continue the baton. You're going to give back to those next generation of scholars who will then also be able to transform lives as we move forward. So our other important goal, of course, is to establish and strengthen equitable partnerships between faculty here at MSU and those on the African continent. So you, and of course, working amongst yourselves as well. I think we've had, over the past couple of years, a great experience around North-South, but also South-South partnerships beginning to unfold as we implemented our program. And we know that many of you are going to continue your, if not, well, we want you to continue your working relationship, but we know you will also continue your friendships. Very important over the year that you've made these long-lasting bonds, and that this will continue even into the future. So in conclusion, for me, it's really important, it's really clear why we're doing this program. I'm passionate about this program. I think everybody who knows me knows this. We want to create a difference and to make positive change across Africa. Your dedication, scholars, and your commitment are essential in building a prosperous and sustainable future for the continent. Women, I think we all are hearing the news even right now, here in the United States as well, how important women can make a difference. Let's work hand in hand to empower communities, foster innovation, and ensure the well-being and transformation of lives in Africa. Know that you have a role to play. Get around that table. So we're looking forward, though, to accepting applications for the next cohort, Cohort 5. There are some changes to the structure of the program, and we invite you all to attend tomorrow to the question and answer session that will explain how this new program will take place. Justin is going to just say a quick bit of info about that session tomorrow. Thank you to the audience for sticking with us. Those of you who are still around, I know we went over time, but there is so much that these scholars have to share, and we're looking forward to their success when they get back home. So thank you so much.
Thank you.
Thank you so much, Jose. All right, as Jose mentioned, our next call for scholars is now live. We are looking for Cohort 5 for the African Futures Program. And to that end, we do have a virtual Q&A session tomorrow, July 25th. As Jose mentioned, there are a few changes to our next cohort to the program structure. So as we receive applicants for that next cohort, we figured there would be many questions around that program. So we are taking the opportunity to answer questions from potential applicants or those interested in the program So if you do have any questions about what the program is like or what the future holds, please register to attend tomorrow. I have dropped the registration link in the chat. It should be about an hour. It will be 8 a.m. Eastern time tomorrow, but the registration link should convert that for those who are in different time zones. So in conclusion, as Jose mentioned, we would like to thank everyone for joining us, especially our scholars for all of their hard work over the past year. Special thank you to their mentors, both at MSU and at their home institutions. And we will be sure to share a recording of today's session with all of the attendees. So thank you so much and have a great day.
Thank you.